morning, Hallfield Health Centre. Can I help?
It's about quality of life for me.
Yes.
And my life is not a quality life.
No.
It's like being in a prison.
What are you worried it might be?
Skin cancer.
What actually happened?
I'm a boxer.
Right.
And I got caught with a shot.
I fell onto my head.
Right.
I was paralysed neck down. My ankle went up. I heard it crunch and pop and...
We need you in the NHS for a long time, so you need to look after you.
Profile Centre, can I help you?
Georgie.
Oh, where's this doctor?
Hi.
Hello.
Come on in. Have a seat. So what's been going on?
She's been getting a lot of nosebleeds, but coming from just this side of the nose, but she's getting a lot of them in school.
Oh, right.
The first aider said to me today it's going on bleeding for at least 5 to 10 minutes.
OK. How often are they coming then?
She could at least have 3 or 4 a week.
Right. And how long's that been for?
Like the last 2-3 months.
OK.
One week when we was in school, she had quite a big one, they couldn't stop it.
Right.
And she said to me, well, if I was you, get her checked, because she could have a blood vessel or something like that.
Yeah, well, it's definitely a burst blood vessel, because that's what's causing all of the bleeding. Should we have a little look and see what's going on? But there's nothing, you're not feeling unwell with it or anything like that? No.
Hello.
Hi.
Have a seat.
Thanks.
Right, what can I do for Hugo?
His eyes, I've been a few times.
Right.
And I've been to see the health visitor as well.
Yeah.
And I'm getting a lot of conflicting messages.
Right.
Every time I come here, the GP's told me that it's kind of normal for his eyes to be this sticky.
Yeah.
The health visitor told me it's not, it's definitely an infection.
Right.
And it's just when he's waking up from nap.
Yeah.
And in the morning, he can't open his eyes.
So have we tried any antibiotic drops?
No.
No. I think that's what we need to do.
Yeah, okay.
So the thing I think that we're probably not passing on to you is that he's got conjunctivitis, it's obvious, isn't it? And it's a bacterial conjunctivitis.
Because this, I cleaned it before we left the house about 10 minutes ago.
I think the thing is, often it clears up on its own over a few days with just wiping it. But if it hasn't, you need antibiotics. How long's it been there for?
5 months, probably.
And we haven't used antibiotics?
Once when he was about 2 weeks old.
Right, OK. So let's try them again.
Yeah,
OK, if it doesn't settle, then come back and see us, OK?
I've just been feeling so frustrated every time I come. I'm just like, my baby's got sore eyes and it's just like, I'm having to open his eyes up for him every time he has a nap.
Oh, bless him. Yep, so 4 times a day. OK, be careful to wash your hands and everything because it is quite infectious. Give it a week, 10 days. If it's not clearing up, come back.
Yeah.
OK?
Oh, thank you. Hugo, sort your eyes out. You'll be able to see again.
OK.
Thank you so much.
No problem. Pizzaurus Rec, eh? That's fantastic. OK.
Thanks.
Bye-bye, sweetheart. He's gorgeous.
Just look up for me. Oh, yeah. Is it itchy?
No.
And this one's OK?
Yeah, that one's fine.
Yeah. And this is the only place that you're bleeding? You don't get any bleeding anywhere else?
No, nothing.
No other bruises to see or anything else?
No.
Because it's really common to get nosebleeds. And what I can see up your nose is that there's a little area which is the place that you get nosebleeds from that's got a little bit of a crust over it, and that's where your nose is bleeding from. And mostly, if we give you some cream, that will settle it down, because often what happens is you get a bit of an infection there, and it stops the nose blood vessel from healing up very well, and that's why it keeps bleeding, all right? And it's not a serious medical problem, it's just that you've got nosebleeds. And as long as you're not feeling really dreadful and unwell, then that's all that we need to do. The most important message is to learn how to stop them. because there should never be a kind of nosebleed that you want to, you don't want that to carry on for you.
She panics, and she was panicking and made me panic.
And that's part of the problem often.
Yeah.
So you need to learn how to stop them on your own, OK? And the way to stop them is to get your finger and thumb like this. You put your nose right in the middle and grip really tight. Now, often people say grip here.
Nose.
Means no difference, because that's just bone up there and hard cartilage, so you can't do anything there. And sometimes people say, put your head back. Don't do that either, because then the blood all just runs down the back. You need to hold it like this, but really grip tight, and then you need to hold it for 10 full minutes. And then 99% of the time, that will have stopped all the bleeding. And obviously, if it carries on after that, then try it again. But if it doesn't stop after that, then you need to go and see somebody, because then it's really not stopping. But the major problem is that you don't press for long enough.
Press for long enough.
All right? And then if this isn't working, then we'll see you again, just to follow it up. All right? Cheers, then.
Lovely, thank you.
Bye.
Bye.
Firstly, how are you?
Terrible for the last couple of days, to be honest.
Right, what's been happening?
Feel tight around the chest all the time. Slightest exertion, I'm breathless. But I keep going and it sort of diminishes a bit and I can get over it. And then sleeping, lie down, I feel as though I'm suffocating. I sort of get a panic attack, start breathing again, and I found it better last couple of nights, basically sitting up, trying to sleep.
Right. Over what period of time do you think this has happened?
This last bit now is about 3 or 4 days, isn't it?
Yes, it's over the really hot weather and his feet are very swollen.
Yeah, they've never been like that before.
No, so this has happened over the last 3-4 days.
Yeah.
Your ankles have swollen up, but more importantly, you're getting more short of breath when you do something.
Yeah, it might be coincidence. It seems since I've been taking the beta blockers that it sort of pronounced it more, if you like.
But you're getting chest tightness, are you?
Feels like I've been sort of squashed a bit.
And that's for how long?
Only seconds.
And how do you think Alan's been?
Constantly sleeping. If he sits on a flat surface, he's asleep. And he does this regularly.
Okay.
And I can be talking to him like I am you. We're having a conversation, he just closes his eyes. And then wakes up 3 or 4 minutes later, has no recollection of the conversation we've had, which was symptomatic of last time before he had his heart operation. Actually, he used to do that quite regularly.
Still really painful, actually. So it's all up this bone here.
Now I feel pain everywhere. And
Lower down.
in my leg.
OK.
I've sort of landed with a straight leg and it's bent sort of the wrong way.
Arms up.
Ow, there.
It's really limited, isn't
yeah,
it?
It is.
Hi.
Hi.
What's been going on?
I fell down a rabbit hole.
Oh, dear, right.
My ankle went up. I heard it crunch and pop and...
Right.
So I've just been getting on with it, but it's not getting better and it, I can't bend it. You know, like when you sit on your foot,
Yeah.
I can't do any of that.
OK.
So I think there is some...
And were you able to walk on it at the time?
Oh, well, it was a struggle getting home.
Yeah.
But yeah, I've just sort of like pushed
Just kind of
through
got
it.
on through. And what have you been using for it?
Nothing.
This was which day?
Right, 7 weeks ago.
7 weeks ago?
Yeah.
So what's brought you up tonight, then?
Well, it's just not getting better.
Yeah.
I am going on holiday on Tuesday.
OK.
So I just wanted to check before I went.
Yeah, because I think, if you did sprain your ankle,
Yeah.
which is what probably has happened, then it does often take months to get better.
Yeah.
Is it sore at all?
Yeah, it's more here.
Not round the back, though?
No.
Move it round and round.
It's there.
This is where it's sore, yeah.
Yeah.
That's where it's painful. Because that's the classic spot where you get a sprained ankle.
Ah,
Is it sore on your foot itself?
No, it's there. I'm going to bend it.
What about in here?
Yeah. I'm trying not to cry.
But it's more in here rather than in there?
Yeah.
It's more in over the foot?
It's all of it.
I mean, I think most likely this is just a nasty sprain that you've got. It can put people on crutches, so just because it's a sprain doesn't mean it's not serious.
Yeah.
And it does mean that it can go on for months. It can be worse than a break because actually the ligaments heal up less quickly. Because it's actually more over the foot, though, I think it is reasonable to get an X-ray.
Yeah.
I will arrange that for you to go up and just go and have that.
Drop in.
Yeah. Do you want some painkillers?
I've got painkillers.
You've got some?
Yeah. Is that just any day?
Yeah, 9 till 5, Monday to Friday,
9 to
so you can
5.
go up tomorrow.
Lovely.
And then why don't you give it a week and then ring just to get the result?
Yes.
All right.
Thank you so much.
Cheers then. Hopefully it will just, there won't be anything there, but if there is, then we'll do something more about it.
Thank you very much.
OK, bye.
Bye.
Do you ever feel as if your heart's jumping beats?
Not really, no.
No. OK, fine. So it'd be good to have a listen to your chest and heart as well, if that's OK.
Yeah.
So we just pop onto the couch here. Nice breast with the open mouth. And out. Let's help you pop that on.
Oh.
Get proper service here, you see, when you come in. There we go. I think what we need to focus on is just this heart rhythm. If you don't mind, it would be good to have another ECG or heart recording now.
Yeah.
And I'm probably just going to have a word with the cardiologist because I'm wondering if we can just sort you out a bit sooner. And also another blood test. Is that all right?
Yeah.
So we're going to take a seat in the waiting room and they'll call you through into the treatment room. All
Yeah,
right,
for,
but we'll
for
sort you out.
for months and years, don't come here, and then suddenly...
Here every 5 minutes. That can happen. That's
Yeah.
all right, we'll get through.
OK.
Come on through. Thank you. Once you've had the recording, if you still take a seat back,
Yeah.
and I'll talk to you at the end, OK?
OK, yeah.
Lee Haskins, please. Have a seat.
Thank you.
Right, what can I do for you?
What it was, I got whiplash down my neck on Saturday.
Yep.
But it's done something to my arm and it's like on numb.
Right.
And I can't lift it to a certain level and it feels really weak. There's nothing there.
What actually happened?
I'm a boxer.
Right.
And I got caught with a shot. I can't remember if it was on maybe my face or something, but it's like whiplash my neck.
Different people have different terms for things, OK?
Yeah, of course.
So what do you understand by whiplash?
I just like put my neck, burn the sensation down my neck.
Right, OK.
I kind of can't twist it.
Can't twist it, OK. Well, how did you feel immediately afterwards?
I felt fine in myself,
Yeah.
just the burning sensation down my neck. I didn't even know there was something wrong with my arm until I got up and then I tried to kind of throw something back and then it was numb.
Have you taken any painkillers for it?
No, took nothing, no.
No. Any particular reason?
Just thought I wanted
Just
to.
your hard.
Yeah.
OK, fine. And have you had any injuries on your neck? Bad injuries before?
No, nothing before, no.
No, OK. And I can see bruising around there. Is that from the
from the
boxing?
fight, yeah.
OK. Was it a good fight? Did you win?
I lost, but it was good. It was a very close fight, but this happened early in the fight, so if it didn't happen, I would have probably won the
Absolutely.
fight. Yeah, so
right, OK.
we're looking at a
Let's have a
rematch.
little look. Right, if you slip your
Okay,
hat
sorry.
off, what I'm going to do is just see your neck movements, if that's all right. So move your head right back. Yeah.
Yep.
Chin onto your chest.
I feel that.
So you feel like, as in pain?
Yeah, a little bit of pain right there.
I've got a 65-year-old chap who's come in with basically symptomatic with chest tightness for the last 3-4 days, which radiates to his jaw and neck area. He's feeling more tired, a bit more breathless when he does anything and when lying flat. And his ECG today, it's clearly keeps varying. It's 154 at the moment. Yeah, he's here in the GP surgery over at Hallfield, so I'll get an ambulance to transfer him over. Yeah, lovely. Thanks very much. Cheers. Bye-bye.
How have things been since we spoke on the phone?
Finally, my headache receded on Saturday.
Good.
But even just moving my head, everything felt totally bruised inside. And this swelling that I've been getting for years now is beyond a joke.
Yeah.
When I got up first thing in that morning, my head was like a football, where normally it swells from here. My whole face, I was so shocked when I looked in the mirror, it wasn't like me at all.
Tell me what things you think have been ruled out with it.
They ruled out, well, they were concerned about meningitis and possibly a hemorrhage, you know, in the head.
But I think the headache has resolved now, so really it's the swelling issue that's the problem that you want to...
I've never had a headache like that in my life, ever. And I feel very, very unwell. I'm at the end of my...
So I I confess that I don't know what it's caused by, and we have discussed it a number of times before. And I know that you've discussed it with specialists as well, and in particular the specialists that know you best, which is the rheumatologist, because of both of your rheumatological problems. And so I don't know what would be next, to be honest, and I am aware that sometimes when that's the story, very occasionally I've missed something, and so have all the other doctors, and there is something that can be sorted out, but quite often we just don't know, and we never will know, and...
It's making my life absolutely miserable.
Yes.
On top of fibromyalgia and arthritis and everything, every other condition.
Yeah. Then there's kind of just trying to manage the problem,
That's what I've been trying to do that for years. I mean, that's why I've come to a point now where I've tried everything I can think of, but I'm nowhere further along the line, except I'm actually worse with it.
Yeah. So the other thing that we have done is you take a water tablet.
Yes, every other day. Yeah.
Do you think on those days you're any better?
I actually think if I had them daily, I probably wouldn't have the problem of constantly going the entire wipe that day out. I think that my body would balance better.
Well, I would be happy for you to try that out as a sort of trial of treatment, really.
Yeah, that's fine.
And
I don't want to stay on it if it doesn't work.
Because my feeling is that apart from moving your drugs around a bit to try and improve the problem, what I would like to be able to do is to try and make things easier for you.
Yes.
And that is, I think, our best option. How does that sound?
Yeah, that sounds sensible. There's one thing I wanted to ask you today.
Yeah.
I've been thinking about this for the last couple of years.
Yeah.
You know, I'm willing to take my medications and do whatever I can to make my life better.
Yeah.
However, I do not want to be resuscitated if anything should happen.
Right.
So could that be put on my notes?
Yes. So...
I've spoken to my children about it.
OK. So that's an interesting question. So normally we would have that kind of discussion if somebody had a life-threatening condition or they were very frail, which you don't really have either of those things. So you are neither very frail nor have a life-threatening condition.
I certainly don't look frail, but...
no, I think, you really don't look frail. We have a form that we fill in for that kind of thing. Where we write down that we've discussed it with you, that you have agreed that's what you want. And then, so what we do is we then use that form and send that off to the ambulance service so that they know not to resuscitate you, otherwise somebody will call and you will be resuscitated.
That's right.
And that form needs to be with you, so it stays in your home.
But it's about quality of life for me.
Yes.
And my life is not a quality life.
No.
It's like being in a prison.
Yeah, well, it's very difficult. The request for DNR, do not resuscitate, was unexpected. There are protocols that we go through to make sure that we're making the right decision, that the patient is able to make the decision, and if not, we would convene a best interest meeting. I think that Julie Dawn's able to make that decision herself. But in this particular case, I decided I would have a think about it myself and also talk to some colleagues. Just going back to the water tablet thing, you only get 28 tablets at a time.
Yes, that's
Shall I
right.
change that so that you can be on them daily?
Yes.
Yeah?
Yeah.
And put that on repeat. All right, well, let's hope that you're right about the water tablets.
Yeah, I hope so. It would be lovely to have a simple answer, wouldn't it?
OK.
Yeah, can but try.
Yes.
All right, thanks very much. Yeah, that'd be fine. Thanks ever so much.
That's all right. Bye now.
Bye-bye.
Hello. I've got an appointment at 10:20. I can't remember who it's with.
So it's Dr. McLaren.
That's it. I can't remember the name.
No problem. We can always find it. OK, take a seat then.
I got my own, thanks.
How many times do we say that? Habit.
Right, OK. Arms now. If you hold my hands, squeeze them really tight. Really tight, as tight as you can. Hurt me.
Sure.
Yep, absolutely. I'm hard. That's it. Pull me towards you. Pull me really hard. Good. Push me away.
Yeah, that's where I don't feel
That's not working, is it?
No.
No. Right, OK. Just relax. I'm just going to check your reflexes, OK? Right, OK. I'm just going to touch you with my finger, like that. OK, if we roll these back up, if that's all right. So you shut your eyes and say yes each time you feel me touch you.
Yeah. Yep. Yep. Yes. Yep.
So you can't feel there, can you?
Yeah, no, that's a bit...
So that feels different?
Yeah, this feels a lot different.
So can you show me where it feels different?
Just like down this line.
Yeah. Right. So I think you've done something that's caused a problem with the nerve going into that shoulder, down that arm, and causing the power problem. It's probably in your neck.
Yeah.
I'm a little bit concerned about that.
Is this a fairly recent tattoo? It's on the blue ink, isn't it, that it's lumpy-bumpy? If you feel there, it's not.
I think part of it is infected. It's passing sort of here and here.
Oh, nice, nice matching pair. If I get a proper tattoo, I want a big one.
OK, fine. You can pop your T-shirt back on. So I'll refer you for an urgent MRI, OK?
OK.
If things get worse, please come and see us sooner. So if the power reduces even further, the numbness spreads, the range of movement of your neck, shoulder gets worse, come sooner.
OK, brilliant.
Is that all right?
Yes, no
But you
problem.
can take painkillers.
Is there eventually at any point I can get like a letter to send to my manager?
Saying what?
Well, because we want to send it to the board that I had problems with my arm, so we maybe get a rematch and stuff like that.
OK. So. You'd have to request a letter, and there would be a charge for it.
Yeah, that'd be fine, yeah.
So you could do that via reception, OK?
Reception, yeah. OK, no problem, thank you.
No
Cheers,
problem.
Doc. Appreciate it.
OK, bye-bye.
Do I just get a letter?
You'll get something in the post,
yeah. Okay, thank you.
All right, bye-bye.
Come on in, come and take a seat. Right, I'm Dr. Ahmed. How can I help today?
For about 3 or 4 weeks now, I've just been getting a flare-up of eczema.
Right.
And it's just not going away.
OK. And have you had eczema since you were a child?
Yeah, and it just flares up when I'm stressed and overtired.
Any reason why you're stressed at the moment?
Yeah, there's a few reasons, but they're things I'm dealing with, so work and stuff.
What work do you do?
I'm a ICU staff nurse.
Ah, OK.
Yeah.
How are they treating you up there?
Oh yeah, it's fine. It's just the type
pressures.
of work. Yeah, you get some sad cases in and affects you more than you realise until you get home.
So do you have sort of strategies in place to switch off from when you come back from work?
I live with 10 people, so I switch off pretty easily when I get home.
There's plenty of people to talk to and things like that. I think that's the main thing, is to talk about it, because you're involved with those cases, aren't you? Do you know about Bristol Wellbeing Therapy? It's just an independent...
I've seen it on our intranet thing.
Yeah, just if you want an independent source of counselling, if you wanted it, there's some information there, and you can do the form online.
Thank you.
And sometimes they just do random workshops that you might be able to attend, and it's just an outlet, really, for the kind of work that you do. You don't smoke, your alcohol sort of intake's fine. Yeah. Let's have a look at it.
So it's
just
always
that.
patchy.
Yeah.
So it's there and there. And then
Your face is all right, isn't it?
It's
Backs of
normally
the
around-
knees? Or?
No, I was hoping to give blood next week, but I don't think they're going to let me now, so...
OK. So I'm going to just do a prescription of Hydromol. And at the moment, with the way the eczema is just on the arms, you don't need a strong potent steroid, maybe just middle of the range.
Yeah.
And I'm wondering if on the same prescription, because I know it's difficult for you to get in, if I just put some 1% hydrocortisone, which is milder, then you can step down.
Yep.
Anything else I can help with?
No, that's great, thank you.
No, fine. OK, so the eczema we'll get on top of, but longer term, we need you in the NHS for a long, 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 long time.
Yeah.
So you need to look after you. OK.
Thank you very much.
That's all right.
great.
Nice to see you, Bethany.
Have a nice day.
Thanks. Take care. Bye.
Young Zhao?
Yeah. This way, James. Come on.
Hello.
That's a very cool hairstyle. Look at that. That's brilliant.
Right.
Right, I'm Lizzie. I'm one of the urgent care clinicians.
Yeah.
How can I help you?
Yeah, the right hand nasal hasn't been feeling well for a couple of months so far.
Couple of months?
Yeah, at the beginning I had the cold, but the cold is after the cold's gone.
Do you want to have a seat?
Yeah, I just it feels like, you know, every time you have a sneeze. But recently when I lower my head or just knee down, pick up something from the ground, it's a bit sore.
Painful when you lean
painful.
forward.
Just
Have you ever had any problems with polyps at all, with any growths inside your nose?
I constantly had blocked nose when I was a little, and then they gave me treatment by putting some patches along my ears, but.
So since a couple of months ago when you had a cold, what is it? Just this sensation that's just never gone away?
No. It's not gone. It's getting a bit worse. It takes longer to get that feeling gone.
Let's have a feel of your sinuses. Do you have any pain when I press around here at all?
No. No.
Any pain here or here at all?
No.
No. And what about over your eyebrows?
No.
No. Okay. Right, let's just have a look up your nose. You're full of energy, aren't you?
Yeah, always. Always.
Just pop your head back for me. That one might be a bit big. Right, if you just slide down on the chair and put your head back there, let's have a look up your nostril. All right, I can't see anything obvious in there.
That's good.
I can't see any large polyps, like large growths or anything like that. I think we could try a nasal spray.
That was I'm coming for probably.
That was what you were thinking, to try something like that?
Try something like that, just to see whether it
works. If we
works.
give that a go and see if that helps.
Yeah.
If it doesn't make any difference at all, don't go in there.
No.
Just come back around this way.
You see more stickers on that. Yeah. So,
So one spray in each nostril twice a day.
Okay.
Try that every day. If the sensation gets any worse or you get any other symptoms, come back sooner.
Lovely, thanks very much.
All right.
Thank you very much for your help. Thank you. Thank you, doctor.
Thank you.
Yeah. Let's
Bye.
go. Bye.
Paul Michelle, please. Paul Michelle. Oh, there you are. Hello. Hi, you come along.
Okay.
It says lumps on head on the screen, is that right?
Yes.
Okay, tell me about the lumps on your head.
Well, I think I probably have mentioned them in the past.
Okay.
But it just seems to me they're getting bigger. And
Okay.
three independent witnesses have told me they're getting bigger.
Okay.
I can't tell.
Yeah.
And they're a bit flaky.
Yeah.
They frighten the grandchildren.
Oh, right, okay.
And I suppose I'd like you to wave a magic wand and make them go away, but
frighten you?
failing that, some reassurance, I think.
Yeah. What are you worried it might be?
Well, skin cancer.
Okay, let's have a look at that. So do you think this is enlarged?
Well, I'm not the best person to ask because I can't see. But, you know, for example, my dentist that I've been going to for years, you can get back, flat in the dentist chair, and he said, they're getting bigger, you know. And then my barber said, they're getting bigger, you know.
Yeah. But this one isn't in the way of the hair, is it? He says unkindly.
Sorry, this was what?
I said this one's not in the way of any hair.
Well, no, I mean, that's increasingly the case.
I can't speak, can I? This one here, I feel confident is something called a seborrheic wart.
That's caused by a virus, is that?
No, I don't know what causes it, to be honest.
Oh,
It's not caused by a virus. It's the one
Okay.
thing that isn't caused by a virus. I'm not sure what you would call that. It doesn't have any malignant features. Okay.
Right.
So these two dramatic things that scare the grandchildren.
Yeah.
Okay. I think they're both benign.
Yeah.
I'm 99% sure they're both benign. I think probably we shouldn't be doing anything with them, but let's get some pictures taken of them and just get their reassurance on that. Is that all right?
Well, as I say, I think reassurance would
And if the
be
dermatologist
something.
is unhappy with them, we'll get someone to take a biopsy or to even to remove them.
Yeah, OK.
The pictures then get sent off to the dermatologist. The dermatologist usually responds very quickly once it's been. So you might wait a bit for the appointment to have the pictures done, but normally within, well, 3 days, we've got a reply back saying this is what you need to do about it.
Yeah. Well, OK, that's fine.
Is that all right?
Yeah.
So you could wear a hat, I suppose, not to scare the grandchildren.
Well, I do wear a hat on a sunny day like this. Does you think that makes any difference? I mean, is it a... I mean, it's
I don't think it makes any difference to those, but it's good advice generally, isn't it, when you haven't got much hair up top. So if you go and book that with Kay in the treatment room, let's give it a week after you've had the pictures taken and then phone me and discuss what they've said about it.
OK, yeah, that's fine.
OK?
Yes, thank you.
Super. Cheers then. Bye, bye.
Hi, how are you doing?
Yeah, I'm all right.
Good.
So it was just because I'm thinking might try for another baby some point in a few months later in the year, and wanting to come off the sertraline and just kind of make a plan for that. So,
yeah, OK. How's everything been going from that side of things?
Yeah, good. I mean, I think I'm just a bit of an anxious person, but yeah.
Well, that's all right, but actually things have been quite calm and settled in the last little while?
Well, we both changed job and moved house.
Right, so with
in January and
all
February,
things considered, because
yeah,
that's a stressful time, isn't it, if you do all of that stuff?
Yeah, but we've just had a holiday. And,
yeah. I mean, you're looking very well for it, you know. So
thank you.
And you're thinking about another baby, so that's exciting.
Yeah, not immediately.
Have you done any reading about sertraline and the risks of being pregnant with it? Or?
No, I just presumed I would come off it.
Yeah, I mean, generally that's the right thing to do. There are some risks of, rare risks of the baby not forming properly if you conceive on sertraline, although that's a rare thing. And of course, if people are so ill that with the mental illnesses, you know, anxiety or depression, that they need the pills, then the risk would be greater to stop them rather than to conceive on and off them. So it's a bit of a balance, is I suppose what I'm saying. And I think for you, if everything's going really well, then this is an ideal opportunity for us to think about cutting it down, because actually, anyway, if you're going to have a baby or not, we should be cutting it if you don't need it, isn't it? So, do you think that you're going to be all right on cutting down? Do you have any worries about that?
No, I think a bit of a wait and see.
Yeah.
The only thing is I've missed a couple of days here and there, and I felt a bit off, queasy, like more physically.
Okay,
but then I figure we'll do it slowly.
Sure, and I think that would be the main thing to say about coming off it, is that people do really notice when they come off them. And that's fine. It's common and normal to get some side effects as you reduce, but it just means that we need to do it really slowly.
Yes.
And so sort of over 4 weeks as a minimum, and sometimes even stretch it out even longer. And what you can do is either just miss out a dose and then take one the next day, or you can just take half a tablet as a way of reducing. Does that sound okay?
Yeah, that's
Do you need any more today?
I've got
to get you through
box, I think.
Okay.
So.
Because that one box is a month, and so actually that will give you plenty of tablets then to be able to do that.
Yeah.
Does that sound like a reasonable
Yeah, that's absolutely fine.
I probably don't need to see you again unless there's any problems.
No, I'll make an appointment if I need to.
Great.
Yeah,
I think that's the thing.
fine.
Or if it gets really bad, just give me a ring.
Yeah.
Or just go back to the dose that you were feeling fine on, because actually then you can just cut it down even more slowly.
Okay.
All right?
Thank you.
Good luck, fingers crossed, and I look forward to seeing you as and when.
Take care.
Bye then, nice to see you.
Come on in, have a seat. I'm Dr. Graham.
I've got an existing injury. I had a spinal injury in 2008. And I have a weak arm.
Yeah.
But today, all day, I've had really bad pins and needles, and I felt really tight and uncomfortable, and it's just making me feel really anxious with it, which is probably not helping.
Yeah. What was the injury that you had?
C5-6.
Right.
So I've had an operation. I've had nuts and bolts in
Yeah.
there. So now and again, I will wake up with pins and needles, and when I'm working it too hard, I get pins and needles.
Right.
But it's been constant today, and it's been really nagging.
Yeah.
And it just doesn't feel right.
Yeah. And what do you think might be going on?
Part of me thinks maybe a trapped nerve or something. I've been feeling it in my leg a bit.
Right.
I'm not in screaming agony.
Yeah.
It's all numbness. I was struggling to hold a pen. You know, I could hold it, but not for long.
Yeah. And when you had the surgery before.
Yeah.
Had you had an accident that caused that, or was it?
Yeah, I fell onto my head.
Right.
So I crushed the nerve and it crushed between the discs. So the discs have come out. I was paralysed neck down.
How are you, Mrs. Smith?
OK, thanks. Not too bad.
Good. It's nice to see you smiling.
Can I take my coat off, you don't mind?
Yes, no, that's not a problem. Do you want to pop it behind the chair? Is that OK? Or you can hang it up on the other...
John!
You're not wearing your designer coat then today? Don't care about that one. OK. You gave me a book last time.
Yes.
On meditation and mindfulness. And I'm symbolically giving that back to you.
You were very gentle.
That implies that if you've experienced differently before... Your blood pressure's been quite steady.
And I've got no worries, my darling, thanks to you.
Well, it's a bit up this morning, actually. Blood pressure. Carl Hazard, please. What's on your mind this morning?
Right, I've got a history of osteomyelitis in my right ankle.
Mm-hmm.
A couple of days ago, I had a bit of a temperature and quite a bad headache. And I woke up this morning and I've got real bad pain on the inside of my right leg and sort of from the groin to the knee.
OK. You've got a history of spina bifida and you've got this problem with the right foot.
Yep.
So there's a combination of orthopedics and plastic surgery.
Yep.
Spina bifida is a condition that occurs in utero, in other words, when you're pregnant. It's a problem with the development of the spinal cord and its coverings. It can result in problems with muscle weakness as well as fluid around the brain.
This is quite sore down here as well, where I've got the muscle graft.
OK. And I'm going to just pop you behind the curtain here.
Yep.
I just want to have a listen to your chest and have a look at the leg. So, is it all right to call you Carl?
Yeah, of course it is.
She says, having called you Carl all morning. Now, there we go. All right. Carl has a significant past history of osteomyelitis. This is a very serious condition whereby you can get an infection in the bone. We also have to bear in mind that Carl has metalwork in his leg, and this is a foreign body. If that gets infected, it can be threatening to the limb in the sense that he could lose that limb. OK, and there's pain in the groin, isn't there?
Yeah.
Does it hurt when I touch?
Yes.
OK. Can you push up against my hands? Good. And on this side? Good. OK. I'll let you get dressed. Take your time.
OK.
Is it stopping you from doing anything?
Not really stopping me doing anything. It's just when I walk, it's just gets a bit painful.
There's no signs of any infection.
OK.
I think it would be a good idea to run a blood test this morning because we'll get the result fairly quickly. It may be worth just reviewing you back next week.
OK.
And sooner if things haven't settled or if they're getting worse.
Yeah, all right.
Because of your past history, we're just extra cautious.
Yeah.
But often these things turn out to be just a muscular something or another in view of your
Hopefully
general
it will be.
orthopedic history, you know? Things that would check you over.
OK. Thank you
All
very
right,
much.
that's not a problem. Take care.
Okay, all right. Thank you very much.
Bye-bye.
Thank you. Bye-bye.
You got that.
Well, you would, being a City fan.
All right, so I think you might be right that that the disc may have come out again to a very much smaller degree, and it's pressing on some nerves.
Right.
OK? So you probably know this, but you know you've got your bones in your neck.
Yeah.
All the way down your spine, and in between you've got glue-like stuff, which is called disc, and your nerves come out.
Yeah.
And a little bit of that has come out and is pressing on the nerve, and it's sending the wrong messages down, so the kind of numbness messages, but also pain. Normally, it goes back in again on its own. Do you see what I mean? Okay. But this time, it's staying out for a bit longer than you're used to.
Right.
Does that make sense?
Yeah.
The question is what we do next, OK?
Yeah.
Yep. So the first thing is to think about some pain relief. And the second thing is to think about whether we want to just give it a few days and see if it just gets better on its own, okay? And if it doesn't, then we'll probably do another head scan to see what's happening.
Would that be like an MRI?
Yes. But I'm not saying you need that yet. You know, we know...
I'm reassured that it's something connected with what I've already...
I think it's most likely to be exactly the same as what you had before. Obviously not the whole neck down, okay? No, painkiller-wise...
I'm not in a massive amount of pain.
Okay. So the kinds of things that would worry me and make me think we need to see you sooner would be if you were to get any problems with your bowels or your bladder, you know, losing control of either of them, you know, because that is a worry because it's affecting the nerves that control your bowel and bladder, and that is an emergency, really.
Okay.
Okay?
Thank you for the reassurance.
Okay, good.
Much appreciated.
That's
Lovely.
all right.
Thank you. I'll go and carry on.
Okay, bye now.
Cheers, bye-bye.
Camera. Okay, hi. Right, let's just bring up a chair. Do you want to sit in that one and Mummy can sit in that one?
Because this is for you, not me.
This is for you. This is something to do with his ears, I gather. Is that right? Yeah. Just fill me in.
He had a perforated eardrum.
This is when he saw Lizzie Harris recently.
Yes,
yeah?
yes.
Okay. And how's she been since then?
Good, really good. We just want to make sure, because he's not been swimming for a while and he normally does that on Tuesday.
The ear was discharging, is that right? Yeah. Has it stopped discharging now? How's his hearing, do you think?
Good. It's back to normal, I think.
Is it?
Yeah.
OK. Well, that all sounds good. All right. OK, let's have a look. So it was the right ear that was the bad one, wasn't it? And the left ear, as you said, was normal? Yeah. OK. Can I look in your left ear first? Look at that one, your good one first. Look at that. OK. All right, so that is a normal ear canal, normal ear drum, no holes or anything. We wouldn't expect it. If I press there, does it hurt?
No.
If I press there, does it hurt?
No.
Good. Very sure about that. OK, just going to take slightly longer over this one. No, everything looks intact, actually. The eardrum is marvellous at healing itself in the majority of cases. So it looks normal, OK? There's definitely no hole in that.
Oh, wow.
A nice sort of shiny eardrum and no inflammation or anything. So, yeah, you can go back to swimming.
Yay.
Yeah. And I'm surprised you say that his hearing's completely back to normal, because it often takes a little bit longer than this, but... Well, if it is, it is. So that's great. So, yeah, no restrictions, really.
Lovely.
OK. All right. That was quick, wasn't there?
Yeah.
Good. OK.
Thank you.
Cheerio, then.
Thank you.
All right, well done holding the door open for Mum. It's like a trap, isn't it? It's like an assault course. OK, cheerio then. Bye-bye. Bye, Cameron.
All done.
Bye-bye now.
Bye. Bye-bye, boys. Say bye.
Holford Health Centre, Sally speaking.
What would happen if those feelings got worse? What would you do?
Before, especially first year of uni, I drank a lot, for like 3 bottles of wine within the space of 10 minutes.
Have you had sex yet?
If he wants to have sex 6 weeks after giving birth.
Now, I'm going to need you to lie on your side. So next thing you feel will be a slight prick as we put the needle in, OK?
Have you got any illnesses that we should know about that you've had before? Are you on any medication?
I was shot a lot of times.
I'm unhappy to mention it is affecting my sex life.
So what the bruising is?
Yeah, it's actually spread across into my genitals, basically.
Oh, goodness me.
At the moment, we're working on a morning surgery, so if it's urgent for today, it is going to be end of surgery at 11:30.
Sarah, jeans, please.
I've got this,
All right.
on my leg.
Yeah.
Now, this is the 3rd or 4th time it's come up. I've had steroid cream.
Uh-huh.
I've had penicillin antibiotics.
Yeah.
It started off as a bite or a sting on that spot there.
Right. When was that?
8 weeks ago.
Was it?
And it's coming up again. I finished the antibiotics last Thursday.
Yeah.
So it's a week, and it was fine, and now it's starting to flare again.
Just have a seat. I'm going to come and have a closer peer. So when you use the antibiotics, what happened?
It seemed to get better.
Right.
And then but like I say, it's flaring up again.
So when you use the antibiotics, it makes everything better?
Well, it
Or
did
does
do.
it not?
Yeah, no, it did, yeah.
Yeah. How many courses of antibiotics?
First of all, I put bite and sting cream on
Yeah.
it. Then I had steroid cream from the doctors, and then a course of antibiotics.
OK. Do you get psoriasis at all?
No. I've never had psoriasis, although my mother is riddled with it.
Right, OK.
No. Just returning that key.
Wonderful. If I could ask you to put that straight on one of the top first 4 hooks, that would be very gratefully received. Thank you very much indeed. Pleasure doing business with you.
Come on in, have a seat.
All right, thank you.
I'm Dr. Graham.
Hi.
We haven't met before.
No.
You're a new patient here?
Yes.
Yes, you've moved from a local practice?
Northville.
Yeah. So what do you think are your main medical issues at the moment?
My breathing.
Yeah, sounds like it, doesn't it?
Struggling the last few days.
Right. So you've got COPD.
Yeah.
Yep. And any other... You've got diabetes.
Well, they think I have, but they think it might be to do with... because I'm on so many steroids.
Right. OK, well, we'll talk about that in a minute. And then... So you have, obviously, home oxygen.
Yeah.
You've got a high cholesterol, high blood pressure. You've had heart disease.
Yeah.
The steroids, what do you think you're on the steroids for?
That is for...
polymyalgia rheumatica.
I can't never say it.
You've got your cholesterol tablets, atorvastatin, yeah?
Yeah.
Candesartan for blood pressure. Then you've got the bone-protecting calcium vitamin D tablet. Lansoprazole for your stomach. Nebivolol, which is for your heart.
Yeah.
Sertraline, antidepressant, and spironolactone, which is sort of a water tablet. In your last practice, they decided that you do have diabetes.
Right, OK.
OK? Have you seen a practice nurse ever for a diabetes check?
I think I've got an appointment with one to see about it.
OK.
On the 8th.
Brilliant, yeah, you're seeing Mike.
Right,
and he's actually going to do a check of your heart disease, your diabetes and your COPD.
Shall I bring packed lunch? OK.
Bring a packed lunch, yeah, not a bad idea. So the bottom line is you've got a lot going on, haven't you? But it sounds like, to be honest, you're fairly on top of it. You kind of have quite a good understanding, I think, of what's going on.
Yes, I do understand.
Really, your heart scan suggests that you've got a little bit of heart failure, that your heart, normally it pumps like this, but it's sort of pumping like that. And that's why you need a bit of help with your fluid, OK? So I'm your doctor.
Yeah.
And we have a system here where we try and get you to see your own doctor as much as possible. If it's a query, then you can book a telephone appointment and I'll call you back. I think we just need to get you to know you a bit.
OK, then, thank you.
Good.
Right.
Great. Nice to meet you.
Yes. Probably see you again.
Yes, I'm sure. OK, bye
All right,
now.
Thank you.
Sometimes with psoriasis, if you are prone to it, and sometimes it occurs in a place where you've got an injury, a trauma.
Okay.
And of course, the bite and the infection may be enough to cause a patch of psoriasis. Sometimes bacterial infections with the commonest thing that causes skin infections called Staphylococcus. So have you heard of those bugs? Well, they cause skin infections really commonly.
Okay.
They can sometimes cause blistering. So it's a little bit of a mystery. I think what I'm going to suggest that we do is the antibiotics seem to work. I'm going to give you a higher dose and a longer course for 2 weeks and then see what happens. But if it's not settling down, we'll see you again. And if it all goes away, then job's done. All right, nice to see you. Yeah, no problem. Nice to see you. Bye.
Bye.
Okay, that's fine if you'd like to go to the upstairs waiting room.
Okay, no problem.
Thank you. Hello, can I help?
Mr. Apatrasoe.
Yep.
I'm Dr. Lee. Come on down.
Expect to be from China.
Yes.
Or Jet Li or Bruce Lee.
Yes, come and have a seat. People often expect a Chinese doctor with me.
Doesn't matter.
No, have a seat here anyway. I think you're a visitor. Are you visiting us? Or are you a patient here?
For the moment, I need to subscribe, you know, because I need the doctor.
You're up in Brown, and that means you're what we call a temporary resident, I think. But you're living here, are you? Are you going to register permanently here?
I have, yeah.
Where have you come from?
My father from Belarus, yeah. My mother from Greece, from Athena.
Yeah.
And I'm Danish resident. After the high school, I was a security officer from army. SWAT, you know, the special squad,
yes.
you know, paratroops and other things.
Have you got any illnesses that we should know about that you've had before? Are you on any medication?
I was shot a lot of times.
What's brought you here today?
Throat, headache. That's the only reason why I called up, is because I had this sort of quite bad headache this morning.
And how long has he been complaining of headaches for?
Since he started a nasal spray.
And it's all the way from here?
From here.
Down to?
Here.
Down to the back there?
Yeah. Sometimes it's right on the center.
It's in the middle, yeah.
Inside, really, you feel sort of heat.
I was shot a lot of times.
Do you want to tell me a bit about it?
I was cut here. This is from 1986. This is from 92. I have another one here. I was shot here. And 48 part of metal was here.
Oh, yeah.
And take it out. But I'm perfect. No problem with this.
Okay.
The only thing what put me down, it's sinus. I have pain. It's sinus. Yeah. No. I don't feel good.
No. And you're not taking any tablets or medicine?
Today I don't take it nothing.
No, right. So is it here? Just right there.
Yep.
And then if I just take those off. So here's your other sinus. That's your frontal sinus there.
I know it's facial sinus.
Yeah.
I know about this. This you have a lot of sinus.
Yeah, and
but
these
here it's about this one.
And these ones
Not
are all
this.
right, are they?
Yeah. Malar sinus, it's okay.
Okay. Is there anything coming down your nose from up here?
Yeah, was yesterday some like yellow things, and in the morning blood.
Okay. A bloody discharge is very characteristic.
It's good if you.
I'm just going to do your blood.
Go out.
Yeah, but it does make it very likely that your sinus is infected. So you have diagnosed yourself correctly, I'm sure. Okay. Relax a little, and I'll just see what this is going to be up to. It's 184 over 104.
Because of pain.
Do you think? Okay.
I'm pretty sure about this. Okay. Because normally I have 137.
But I'll print you out an antibiotic to take for this. Are you allergic to any antibiotics?
No. I'm allergic for the stupidity. The only thing.
Take this, 2 today,
yeah,
and then 1 every day till you've used them up for a week. That should settle it down. You must now book an appointment for maybe 2 or 3 weeks' time to come and have your blood pressure checked again.
Okay.
And I hope you're better soon. Yeah.
Thank you very much.
Thank you. I hope
welcome
to see you in 3 weeks.
Come on in. Have a seat.
Thank you. Yeah, I was in hospital all of last week.
Oh dear.
Because of the DVT thing. It bled everywhere.
Bled?
I think it was a varicose vein on the surface of that.
Yeah.
I was washing up and it just bled everywhere.
So it was the bleeding that kept you in hospital?
It was the bleeding that kept me in hospital and the swelling of my leg, and they said that the DVTs got bigger.
Have you got an appointment with the haematology doctors, the blood doctors?
Yeah, I'm getting one. I'm literally waiting to hear.
Is there anything to see, or is it all covered up with
It's
the
all
big
covered
dressing?
up.
Let me not look now, because actually, as long as it's OK from your point of view, the nurses are going to look this afternoon. So if there's anything if I take the dressing down and it causes loads of bleeding, then we'll have to get the nurses involved.
Also, as well, I haven't been on them for a while, but I was on citalopram. I feel kind of OK, but I'm kind of waiting to go down.
And was it depression that you suffered with before, or did you get much anxiety with it as well?
Yeah, the anxiety's kind of gone.
And when people get depressed sometimes, they get, other thoughts or other...
Yeah, I have been there.
More serious kinds of thoughts. Has that drifted in, do you think?
Yeah, a little bit.
Hello, can I help, sir? All right, can I help?
That's exactly why I'm here, hearing problem. You go on,
I know, absolutely.
Catherine Amesbury, please.
Oh, that's me. OK.
Hi. Come have a seat.
Nice to meet you.
Right, OK, so we spoke on the phone beginning of June, didn't we, about your X-ray? Yeah. Yes, OK. And how is your back?
Bad.
Right.
I've got a trapped nerve now. It's just constant pain. So I don't know. What did the X-ray show?
Well, it shows some wear and tear, but it also shows reduction of the disc height on a couple of levels, so it makes me a little concerned. Is there any thinning of the bones?
Well, I've got sciatica at the moment all the way down this leg, and my leg's actually not working properly.
Right, OK.
It's really strange. It's like it doesn't belong to me.
OK, can we have a little look?
Yeah.
Myself up on the bed. OK. And if you bend this, so try and pull your heel into your bottom. OK, and push it up to the ceiling. Good, OK. Against again. That's it, right?
That's the weak one. Can you see what's wobbling?
I'll just check your reflexes. Yep. Good. Fantastic. OK, you can jump up for me. OK.
I had a riding injury
in
my very early 20s, and I displaced 2 vertebrae. And it never was quite the same after that.
Sure.
But regular osteopathy. I mean, I can go for 2 or 3 years without seeing her, and then I'll tweak it, and she'll get it right. But this time, I haven't known how to get it right. So, yeah, I'm just frustrated because I can't live my life the way I normally live it.
Yeah.
My maternal grandmother had osteoporosis. She was bent double in her 70s. Right. But I have been on prescriptive calcium, vitamin D since my 40s because there was a risk.
So this graph shows us the green is essentially you don't need to do anything, OK? The yellow is we need to measure your bone density via a DEXA scan, and red we need to just treat. Now, you are very much on the border.
I'd like to know then if I can.
Yeah, I agree. In terms of your pain and management at the moment, are you happy with what you're doing?
Yeah, I don't want any.
No. So we'll wait and see what DEXA shows. If you want some physio, just let me know.
Thank you.
All right, no problem.
Lovely
nice to meet you. Yeah, you
Thank
too.
You ever so much.
OK.
Let me just check. You haven't had any more suicidal...
Not since being at home.
...plans or hopes to die or anything getting so serious that it's got that bad? No.
Not since coming out of hospital.
What would happen if those feelings got worse? What would you do?
Normally, I lock myself away for 24 hours. In the past, what I've done, completely just lock myself away, don't do anything, don't allow myself to eat, don't allow myself to go to the toilet, nothing. And then I normally come out of it. Before, especially first year of uni, I drank a lot.
That's a common reaction or way of dealing with it.
And a lot quickly. So like 3 bottles of wine within the space of 10 minutes, like a lot.
Gosh, that is a lot. Mental health problems are really common, and young men suffering with depression is one of the things that we see very commonly in the surgery. William has suffered with on-off recurrent depression over the years, for which we've been supporting him. The natural feelings that you have when people first tell you about something really deep and personal is to empathise and do your best to be compassionate with them. And then the next stage is to try and move on and come up with some solutions to help them move forward with that problem.
So it sounds, I mean, this is obviously complicated, isn't it? What about any counselling? Are you having anything at the moment? I'm just going to look at your, see if I've got any past history here.
Because I know I was on 10 milligrams and they increased it to 20.
How long have you been on it for?
Oh, God. It was when I was in sixth form, so when I was 17.
Yeah. So you've been on and off it for your mood for 6, 8 years?
Yeah.
It does take between 2 and 6 weeks to have its full effect. And starting off slow and building up is a sensible thing, because then there's less to come off later. Do you want me to organise some counselling for you or give you the details about that? Because that's one of the other mainstays of treatment.
Yeah, that'd be cool.
And as I say, if anything changes or gets worse in the meantime, just let us know more urgently, obviously.
Oh, I do. Awesome. Thank
you
very much.
Nice to see you. Bye, then.
Bye-bye.
Hello, reception.
Hello, I need to make 3 appointments.
Hello, come on in.
Suffering terrible with migraines. Been suffering for about 6 years. I did get a preventative topiramate.
Okay.
It worked, but it stopped working now, so I've just given up taking it. I just thought it's best to come in and see you.
Yeah, have a chat about it. How often are you getting them at the moment?
I can get 5 a week sometimes.
Describe them for me, just
So I go funny in the eyes, and the head feels like it's and it's all pain in the neck as well. Just like a pressure building up, and then you feel like you're sort of slurry talking and things. So it's just strange how they just come on all of a sudden. The Immigram tablets are really great when you get an attack, but they do make you feel a bit... But they're brilliant for when they are needed.
So they're quite effective.
Yeah, amazing.
Yeah.
I just wondered if there was any other type.
Yeah. The answer to your question is yes, there are other things we can try. There are actually quite a few different preventative treatments for migraines.
Okay.
So we often try beta blockers, which were originally designed as blood pressure medication.
Okay.
But we use them for migraine treatment. They very occasionally drop people's blood pressure a little bit, and that can make you feel a little bit dizzy the first time you take it, while your body's adjusting to it. So we'd often try one that's twice a day.
Oh, twice a day.
Initially, I'll give you a month's worth as a kind of trial.
Okay.
If you find that it's not really the answer, give me a ring or come and see me again.
Yeah, it's easier to find sometimes, isn't it? Thank you very much for your help.
Great to meet you.
Nice to meet you as well.
Hello, can I help?
Hi there, it's Dan from Speechwrite. I've got an 11 o'clock with Guy.
With?
Guy.
Glyn.
Glyn, is it? Oh, they put Guy. Sorry, Glyn.
Leave me. The scarf, though.
Just get a phone, come back in.
I'll probably be still sat here.
Probably.
Okay.
If you're not.
Sean Priest, please.
Oh, here we go. That's me. Hey, can you guess what it is yet?
Mate.
Oh, yeah, definitely, yeah.
Right, I'm Lizzie.
Hi.
What's been happening?
So, Tuesday of last week, I had a motorbike accident, collision with another vehicle. Fortunately,
Car?
yeah, well, Volvo, so, you know, might as well have been a tank. Yeah. So I was thrown clear of it, landed on the verge, but I took all the impact on my hip. I managed to sort of bounce off the side of it and do a bit of a Superman impression.
Through the air?
Into the verge on the other side of the road. Basically, I can't sleep. That's one of the main issues because of the pain. Also, I've got some concerns. The blood from the bruise is beginning to spread. It spread around my sort of lower back, down my leg. It spread across my groin and into other areas.
Right.
Yeah.
Okay.
Yeah, so that's kind of a bit interesting there. So.
Okay, can we have a look?
Yeah.
All right.
Sure.
See how bad it is.
Yeah, no problems. I'm unhappy to mention is affecting my sex life, as if having a smashed up hip alone wouldn't.
So what the bruising is?
Yeah, it's actually spread across into my genitals, basically.
So, oh, goodness me. How are you, Michael?
Struggling, very
Yeah.
difficult.
I understand you had a fall a few weeks back, was it?
Tuesday. I'm always falling over my hips.
I don't remember bumping it. And I span, and I fell on my right side.
As I've like jumped and sort of came down and landed on my leg, it's gone backwards quite a lot.
I tripped and then I landed sideways on.
Sleeping is just, forget about it.
When you say it's affecting your sex life,
It's spread into my testicles and pretty much halfway up.
meaning that it's painful or you can't get an erection? Or...
No, I'm functional, but it's tender, very tender, yeah. So, yeah, if I could figure out how to manage that, that would be nice. Or just an idea of how long this is going to go on for.
Right, so, OK, pull your pants up.
Yep.
Come and have a seat again. So, the amount of bruising that you've got,
yeah.
I'm not surprised at. I wouldn't be overly concerned about it. Given the mechanism of injury, we've come away that lightly.
Yeah.
It's probably only down to the fact that you're quite muscly and you've got muscle to protect all of your bones and everything.
And muscle the bruises easily.
Yeah. You've obviously caused so much damage underneath your skin on the hip here.
Yeah.
It's filled to a capacity and then it's not really had anywhere else to go, so it has spread round the other sides a little bit.
Yeah.
Have you noticed it carrying on, spreading further? Or
Yeah. It's reached the back of my leg just today. It was about here before, but this morning it's sort of down there. It seems every time I wake up, it's in new and exciting areas.
If at any point
Yep.
it looks like your circulation is changing at all, if this lower leg starts going a bit of a funny colour,
Yep.
if you start to lose some of the sensation or anything like that, need to see you straight away and probably send you up to the hospital. In terms of what you can do to try and reduce it, the only thing that you can really try is just to ice it.
Is there anything I can do for the sort of pain management side of it and sleep?
Paracetamol, 2 tablets, 3 times a day during the day, and then your 2 cocodamol at night.
Okay. Are there any kind of maybe almost like home remedies I can use to sort of try and disperse some of this blood, or?
Just gentle. You could try a gentle massage.
I'm talking about one specific area.
Not like deep tissue. Oh right, okay.
Yeah. It's not pleasant, and yeah.
There really isn't very much that you can do.
Okay, I'm happy to try deep tissue massage on the area. But,
I was thinking of your leg.
Brilliant.
I would just give it a rest if I was you. Yeah. Just give the whole area, just give it a rest.
Right, okay.
If it's hurting, it's trying to tell you, give it up. Just stop for a bit.
Okay. Put it on the back burner.
Yeah.
Brilliant.
Abigail Lee. You can walk like that.
I can walk and feed.
Well, I'm Dr. Lee, so that's very good.
Yeah.
We share a name.
Appropriate, isn't it?
Hooray. So, is this a girl or a boy?
A boy.
Oh, very nice. And is it your first or not? How? So today, starting with you, how was it?
What, the birth?
Yes.
It went as well as such a thing does.
Yes.
Basically.
It's quite an experience, isn't it?
Yeah, and we had a home water birth. And that went really, really well.
Ooh, did you?
Yeah.
For first baby, that's very good.
Yeah, it went. Yeah, it was. Well, I won't say it was good exactly, but it went well. I didn't use anything, and yeah.
Well, it's very unusual to actually manage your first at home.
Yeah.
Did you tear or have stitches?
I did tear and I did have stitches. Yeah, I had a 2nd-degree tear.
How is it? Has that healed up quite well or not?
Yeah, I think so. I mean, I don't feel anything anymore. Okay. I guess I'm not sure when it sort of. Oh, thanks for that. I'm not sure when it stopped hurting. Really, it did hurt for a lot longer than I expected it to. I have to say.
So, would you like me to have a look, or
I think
if
I'm
it
all right,
feels
to be
fine
honest.
to you, it's never quite the same. As
Yeah.
It used to be. But as long as it's not too tight, really, that's the thing. Occasionally, people get sewn up and they're just a bit wonky or tight, and that often settles down. And
that's all right.
Sex? Have you had sex yet?
Who wants to have sex 6 weeks after giving so much?
Hello, morning. Come on through.
Hand over your mouth when you're coughing.
Come on in.
Hello.
Take a seat. Hello.
You all right?
Yes, not too bad, thank you. So, Riley, you're nearly 11.
Yeah.
You've got this terrible cough.
Yeah, it's been about 3 weeks. Basically said it's starting to hurt his chest a lot, but I don't know whether it's just because he's coughing so much, but it's getting deeper and deeper, so...
So it's been there for 3 weeks already, and it sounds like this day and night?
Yeah, it gets worse at night, definitely. It's constant.
OK. Any temperatures or anything like that?
A bit hot now and again, but nothing major. It's just...
And are you bringing up some rubbish when you cough?
Yeah.
Do you want to put your top things off for me? And is Riley up to date with all vaccines for his age? Looks like he is.
Yeah, he doesn't really go to doctors very often, as you can see. He's very limited.
Yeah.
It's probably been about 10 times in his life.
Let's have a look in your throat. Open wide for me.
Turn out. Ooh,
OK,
where are you going, Babs? It's OK. Who's that? Peppa
Let's have a listen to your chest. If you come up here for me. Yes, please. Pop your T-shirt off. Excuse me.
Where's he going?
Come and take a seat there, OK?
Okay.
Yes, that's fine. Deep breaths through the open mouth. OK.
Where are they going?
That's fine. I'm just going to have a feel if there's any glands around, OK? That's fine. You can pop your things on. Come and take a seat.
How are we sounding then, Doc?
Well, I mean, the chest actually doesn't sound too bad.
OK.
So the cough sounds worse than the findings. So there's no temperature, you know, everything else is sounding OK. I'm a little bit suspicious of whooping cough. Pertussis is the other name. You know, it's just tends to go on for a bit, and it's sort of... Once you start coughing, you go on and on and on and on, and then stop, and then it keeps going on like this day and night. So, I'm wondering whether we should do a swab, actually, for looking for pertussis. Whooping cough is a very severe spasmodic cough, by which I mean you get bouts of severe coughing, and according to the textbooks, a characteristic whoop sound at the end. However, in real life, you don't always get that. It usually goes on for 2-3 weeks, and patients present very tired with their symptoms, often not sleeping due to their symptoms. If you wanted to look it up, you can on patient.co.uk.
No problem.
Website. OK.
Quick nose swab out there, is it?
That's just... If you take a seat in the waiting room,
yeah,
and we'll get that organised straight off. There's a key and a phone.
That would be me, yeah. Thanks. Come on then, Fatty.
Susie?
Hello.
Really? Come here, please.
Hello. No, they can do with all the help. They need all the help they can get. He's just looking at flowers. It's fine.
Yeah.
And did you have any other problems in the pregnancy that I should know about?
My left outer thigh went numb, went about 20 weeks, and it's still numb now. And I assumed after I gave birth, I thought, oh, it will just go away, but it hasn't.
Which bit of... It's on the outer border there?
Starts about here, goes down to about here.
Are you all right?
Yeah, of course.
Take him over here. You can just lie him on you.
Do you think you could hold him just for a sec? So I leak really badly, and I've got these breast shells. It's a bit embarrassing, and I frequently do that as well.
Well, I'm having to practice because my first grandchild's coming soon. So
oh wow! Congratulations!
I know. So this is kind of fabulous.
Just up here,
like that, and then if you take him.
Yeah. Hello, little one.
Ooh. OK, that's great. So here's a bit of cotton wool, and I'm just touching your other leg with that. Can you feel that?
Yeah. Yeah. Yeah.
And how does it feel? Is it...
It's really hard to describe because it isn't...
It's less.
Yeah, it's just less. That's the only way I can think to describe it.
Now, I'm not going to hurt you with this, but I'm just going to... It's a pinprick.
Yeah. Yeah. It's very, very slight, though.
The good thing is the sensation is actually there.
Yeah.
Get that back up. I'll come and help you in a sec.
Thanks.
So the sensation is there. That nerve has obviously been probably bruised at some stage.
Thanks.
I think it's a matter of waiting. The nerve is working because you can feel pinprick You can feel different kind of sensations there, and although it's a bit dull, it will slowly, slowly come back. Sit tight, it will almost certainly just slowly recover.
Hi, I've run out of my pills, but I don't know if I need to make an appointment with the nurse or can I just get a prescription?
Contraception.
Yeah.
A nurse appointment every time you need a prescription.
Oh, is it now? Oh, I thought it was every, like, 6 months or something.
Hello there.
All right.
Come along. So I think Dr. Pitt arranged for you to come and see me, is that right?
Yeah.
Yeah, and prior to that, you'd seen a physiotherapist who thought that it might be useful for you to have an injection. Yes. And they've written in the note that they think you've got something called trochanteric bursitis, which is a inflammation in the layers over the hip joint. Yeah. On which side is that? Is
on the left.
Left side. Yeah. Can you show me where the pain is?
I'll stand up and show you.
Yeah.
There.
Yeah, let me just have a feel down here. If I hit a sore spot,
yes,
that's it there, is it?
Yes.
Oh,
yes.
sorry. Okay. Well, that is over what we call the greater trochanter, so that would fit with this. So what Dr. Pitt suggested was that maybe we put a steroid injection into that spot. So you're happy to go ahead with that on that proviso? Okay.
Give me back my legs.
Sorry?
Give me back my legs.
Well, don't have too high a hope, really. My hope with this is that we will relieve the tenderness at that sore spot.
It's worth a try.
It's worth a try. So I'll need you to get up on the couch. What we've got here is some steroid with local anaesthetic in with it. Any problems after this injection, particularly if you feel that it's inflamed or you've got a fever, do get back in touch with us. Okay. Now, I'm going to need you to lie on your side. I'm just going to mark the point. So next thing you feel will be a slight prick as we put the needle in, OK? I'll need to put it... Is that OK? Not too sore? OK, that's done. All right?
Is it? Is it done?
Yeah, it's done.
That's incredible.
OK, stick that on there. Good, we're done. All right? Do you want a hand down? Are you OK? Sorted?
Thank you very much.
All right. But we might do it again if it does work and it wears off.
It doesn't feel like anything's different.
No, well, it won't work immediately.
Oh,
Give it a bit of
OK,
time.
thank you.
Give it a bit of time. OK, then.
Chris Collins, please. Morning.
Morning, Doctor. Thank you.
Hi, have a seat.
Well, basically, the big reason I came in is for the results. Are they, for the scans? And they took me into the ring thing, that you go in.
OK.
Yeah.
Let me just have a little look. I'll just get up those results. Well, the good news is that the scan is normal, and if you get more blood in the pee in the future, then we should send you back there. But at the moment, that's all that we need to do.
Right.
So that sounds like all pretty good, doesn't it?
Yeah.
And how's your mental health at the moment? How's that all going?
Oh, not too bad. Having moments when I sort of talk to myself a bit. Not answering myself, but...
Has that been stable in the background, or is that...
Yeah.
Yeah.
There is some times when, and I got... He comes from the Greenway Centre, and I talked to him about it, that sometimes I'll look at someone driving past when I'm on the bus and think there's someone I know, like, and it's just trick of the mind,
Sure.
But I think I have, at the station, actually seen a poltergeist,
Great, well, how are you?
What I've got is face ache and constant gunk at the back of my throat.
So the face ache, sinus there, sinus here.
Yeah.
You're talking about her mouth breathing.
Mouth breathing?
Yes,
Okay.
she continuously breathes from her mouth and not her nose.
I'm sick from the infection because I end up swallowing it, and the pressure behind my eyes and in my face is horrendous.
So can I feel on your face?
Yeah.
And is the stuff coming out of your nose?
A little bit. When it is, it's like thick and yellow.
Come on in, have a seat. Right, Maddie, do you want to sit over there? Rio, you can come over here. OK. How can I help?
So Rio suffers nosebleeds
Yes.
quite severely.
Yeah. Through the weekend, he had 4. 2 were very, very bad, really struggled to stop them. I pinch it up here, it then goes down his throat. Yeah. And he spits out. So I literally have to just wait for it to start congealing in his nostril. Yeah. He cries with them as well. I don't know whether or not they're hurting him. Yeah. Since then, he's been very lethargic, very pale. I don't know whether or not he could get anemic from that. I have no idea.
How long did they last for?
So the first one he had, that lasted maybe 2 or 3 minutes. And then a couple of hours later, about 7 or 8 minutes. That was quite a heavy one. But then the last one, the third one, which was sort of in the middle of the night, that was quite severe. It was about 10 minutes. Okay. And we're going through like
show me, Rio, show me what Mum does. Show me where Mum puts the pinching. Up the top there. OK. So you need to pinch much lower down. OK? Ah. So that bit there is a bit solid. You can feel it's a bit solid, yep. Whereas where it's actually bleeding from, almost certainly, is just inside. So what you need to do... Is it always that side? Yeah. That side, so if you had a cut on your knee, what would you do?
Why?
What would you do if you had a cut on his knee? Yes, so you go like that. So to put pressure on the nose, in that bit of the nose, you have to pinch the lowest bit, OK? But mainly it'll just make a scab, and that's what you need, is you want a scab, OK? So can I have a quick look up your nose? So if you just look up at the ceiling, very gently. And he's definitely got quite a good scab there now, OK? So the important thing is not to touch it at all, OK? It's quite common nosebleeds in the summer. Because the blood vessels get bigger anyway. Okay. What I would recommend is actually pinching for 10 minutes. OK. So the bleeding time should be 10 minutes or less. So by the end of 10 minutes, it should have formed a really nice scab. Yeah. And then it just needs to be left alone. Are you happy with that? And, you know, you're nearly at the age where you might be able to do this pinching stuff yourself, to be honest. Yeah? Rather than Mum doing it. Yeah? Nah. Is that all right?
That's great. Thank you so much.
You look very well.
Thank you very much. Getting there.
All right.
Come on then, kids.
All right, kids.
Thank you.
That's OK.
Bye.
Bye now. Bye, Rio.
Well, I know that in the past you've had problems with, you know, ideas that have been difficult to explain, haven't you? And delusions that are linked to your mental health problem.
Yeah. One stage, a car went... This is a long time ago now. Car went past, and do you know Data out of the Star Trek: The Next Generation, the robot? I swore I saw him in the car, which was quite funny.
The mind does play tricks on people, doesn't it?
Yeah, and I actually, I do actually see them. You know, I do actually see... It's not as though I sort of... There's a blank space and I imagine something. I actually see something through my eyes, which is...
And that's what, you know, when people talk about hallucinations, that's what they're like. You know, they're really there for people.
Yeah.
And that's a really good description. So it's certainly not... Nobody's saying that you're not seeing it. It's just that that's part of the mental health issue, we think. Hallucinations are part of a group of disorders called psychotic illnesses, schizophrenia being probably the most common of these. For some patients with chronic psychosis, they don't have the insight that means that they can see the hallucinations and delusions that they're suffering are not real. And this adds huge challenge, as you can appreciate, to how we can support them and treat them. Fortunately, Chris is in a good place at the moment, and his medication is controlling those symptoms, and his hallucinations are something that he recognises, and so currently he has good insight into his mental health problems and how they're affecting him. We'll carry on with you being supported by the mental health team at the Greenway Centre.
OK.
And then I'll see you probably in 2 or 3 months if everything's going well. Super job. Well, nice to see you.
OK, Doctor.
Till next time.
All right.
Bye.
Bye.
Good morning. Have you date of birth?
23rd August. 1953.
It's next week, my lovely. What date? You did it online. 12th, next Wednesday. Exactly the right time, but a week early.
Kirsty Winskill, please.
I like your top.
Oh, thank you. Hi, I'm Lizzie. I'm one of the urgent care clinicians. How can I help you?
We'll go with a throat infection. This morning my throat is bright red. My voice is gone. It's very painful.
Yeah.
I've got a friend's wedding to go to tomorrow.
Oh, no. No singing for you. Is it a church wedding?
No, manor house.
Stand at the back, I just had to mime. Right, OK. Do you think you've had a fever at all?
Hard to tell, I feel hot. But
Yeah, it's pretty hot. Yeah. Not felt freezing cold, though?
No.
No, good. Have you been taking any painkillers at all?
Not yet today.
OK. So your temperature's normal, 37.2. That's good. Let's have a look in your throat, then. Stick your tongue out for me. Nice big ah. So it's quite red. Your tonsils don't look... Yeah, your tonsils don't look too bad. Let's have a feel of your throat now. Is this sore?
Yeah, there, yeah.
All over. Quick look in your ears. Have a stand up for me a second. OK, turn around. Let's have a look in this one. OK, so your ear canals are a bit red, both of them, and your eardrums look absolutely fine. So I think it's probably a viral sore throat. There's no pus on your tonsils. Your temperature's normal, which is good. With tonsillitis, there's two types, there's viral and bacterial. Viral is just really annoying, we can't do anything about it. It's just a case of just waiting and painkillers. I think just, are you off today or have you got to go to work?
In work.
So just a case of rest as much as you can tonight, early night, painkillers, paracetamol, ibuprofen with your food, and the throat spray if you want to get some of that from the pharmacy. Okay. Loads of water, and try and avoid alcohol tomorrow. But other than that, have a fabulous weekend.
Try to.
All right.
Thank you very much.
See you later. Bye.
There's a lovely handbag here. Take care.
Thanks very much.
Bye-bye. Thanks.
Tidy up for her. Tidy up. Don't worry. I'll do
Okay,
it.
thank you. Bye-bye.
Okay.
Thanks.
Bye-bye. Tidy up.
Tidy up now.
Batman? Yeah, OK, brilliant. Oh, I lost 4.5 pounds. It's slim and we're all
Well done. Don't look at the fridge now, then.
No.
OK, bye-bye.
Centre, how can I help? Feels like it's in my back most of the time.
Right.
Sorry, Craig's killing me.
Oh, dear. How many did you used to smoke a day?
30 to 50.
30 to 50
Yeah, when I was
a day?
smoking, yeah.
The right side of my skull is changing continuously. Hurts like hell. Touch it and I scream sometimes.
Each day I wake up, I think, oh, Jesus Christ, another day.
I don't like the look of the colour of that. I don't like the sound of the pain either.
Oh, look at that sun coming out.
Yeah, it's lovely, isn't it?
It's supposed to be all right, isn't it, now, the rest of the week?
It's supposed to be, isn't it? Yeah. Hello.
Alex Slater.
Wrong end.
Come on this way. Well then, come on in. Come and have a seat. Hi.
I have some boils.
Right, OK.
Troubling me for some weeks now. I've tried putting magnesium sulfate onto them to bring them to the surface, but nothing's really helped.
How long have you had those for?
They've been going on and off now for a couple of years.
Have they?
Yeah, I had a 7-headed one, what, 3.5, 4 years ago, on the bottom. That was very sore.
Yeah.
So that ended up having to be lanced. But I just seem to keep getting them. It's small when I shave.
OK.
And it's not sore when I shave, it's normal. But
then you get boils afterwards.
Yeah,
Sounds like you've got an infection there. Should we have a look at it?
No,
is
that's
it?
fine. That's fine. It's
Yeah.
Yeah.
But you're all right if we...
Yeah, no, it's fine. OK.
Can I come in?
Yes. Sorry.
All right, gosh.
What's brought you here today?
JJ has a temperature and he has a cough and he can't really speak very well because he's got a very croaky throat, as you can hear. He had a temperature about a week ago and it's been on and off ever since, hasn't completely gone away. I've been giving him Calpol, Nurofen, lots of water. He's been off his food and I just thought before the weekend comes, I need to get him seen to.
OK, so his symptoms have been for about a week with the cough.
And the temperature, yeah.
Has it worsened? His voice worsened?
Yeah.
Is he coughing anything out?
No.
Right. Shall we look at you?
Take your jacket off today? Sounds like a little monster. Where does it hurt? Tell the doctor where it hurts.
I just need a little feel. Well done. Let's have a listen to your chest a moment. OK, so his chest sounds clear. Can we pop that on your finger?
Oh, yes.
Oh, you're going to do it. Well done, that's it. You keep it nice and still there and look at the numbers when they come up.
What's your favourite number,
Keep your
JJ?
head still.
What's your favourite number 3?
nice
Is
and
that how old
still.
you are? What's your favourite number, Josh?
29.
That's a very unique number.
Can I have a little look in your mouth?
As wide as you can. As wide as. You did it.
As wide as you can. Good boy. Nice and... I can't see any pus there. It sounds like he's had a viral infection, so there's inflammation within the vocal cords.
Right.
Let's just pop this one in your ear. It's not going to hurt, sweetie.
She's not going to shoot your ear.
Well done.
You're so funny, Josh. You're supposed to be calming him down.
That's fine, that's all normal. If after the weekend you're finding that he's not any better or he's worsening, then bring him back and we can review him.
So you don't
Or
think he
if
needs
he
antibiotics
changes.
then?
Antibiotics won't treat a viral infection.
No. All right then, come on then, JJ, let's put your jacket on. OK, come on then, boys. Oh, careful, Jay.
Well done.
Hold on.
I'm much stronger than you. I can open that easy.
Well done.
Oh, careful.
I can
Thank
run
you.
out.
Bye. Bye.
They're going all the way down and then
But they're always just on the outside. They're not actually inside your bits.
They've been going down that way, yes. And I have some. I've had a few on my bottom as well. Oh, but they're so painful.
Yeah, I can see that they are. That's fine. Do get yourself dressed up and come on out. OK, so those infections, those are little boils, as you say.
They are boils, aren't
yeah,
they?
and
Okay.
they're essentially what's happened is when you shave,
Yep.
the
Hair follicle goes down instead of up.
and you get a little bit of infection around the base of the hair follicle.
Why
And
do they not want to come out?
Well, it's because of the shaving that sometimes then you get a tiny bit of skin growth over it, and it just means that it can trap some of the bugs in the hair follicle, and so it happens more commonly when you shave.
Right.
What we need to do is to try and reduce the amount of bacteria down there.
Right. What causes bacteria down there?
Well, it's actually we're all covered in bacteria all over our skin,
Right.
everywhere. Some wash just to help reduce the bacteria there.
Dermal, well, when I wash.
Well, I'm going to try something that's a little different from that, just to see whether that helps settle it down. The other thing to do is just think about not shaving there, because obviously that will reduce the chance that you get the infection
There is
But
that point.
And if you're getting other infections, or you're getting this as an ongoing thing, should we be doing any other tests? It's not unreasonable to check your blood test, as I say, and then we'll see what's happened when we've got the tests. You don't get any under your armpits or anywhere else?
No, I use a different type of razor. I use Bic for there and electric for there.
OK. Blood test you can book in as well, and then I'll see you with the result. All right?
Yeah.
All right. Cheers then.
Thanks, Dr. Pelly.
Bye-bye.
Bye, darling.
Free trips for older people.
Where are we going?
I don't know. I'm just part of the Bristol Aging Better project, offering older people the chance to benefit from day trips.
What are you looking at that for, Jackie?
Well, because I'm an older person, yeah. We're trying to work out where we're going.
Come in, I'm Dr. Gosh. Come and sit down.
Thanks. I'm having problems sleeping. I got this thing where when I get up in the morning, as soon as I wake up, I feel so sick. And I got to get out of the bed because I think something bad's going to happen if I stay there.
Right.
And this has been happening for quite a while.
Okay.
So I've been treated for depression.
Yeah, I saw that, yeah.
But now I'm not even going to bed, I'm just sleeping in the chair.
Oh dear. So what exactly happens when you try and go to bed? Do you get to sleep to start with?
No, as soon as my bum hits the bed,
right,
I feel sick.
But what are you sort of worried about? What do you feel like?
I just think if I stay there and try and go back to sleep, I think something terrible's going to happen. I'm the eldest of 11 children.
All right.
But I've had 3 siblings much younger than me die in the last 3 years.
Right.
And I'm a widow. I've been a widow now 26 years. And it gets harder.
I'm sure it does.
People say, oh, time's a great healer. It's not.
Still very lonely, isn't it, for you?
I've wanted to die for the last 26 years.
Have you? There's a bit of wear and tear there.
It's old age.
It's not old age.
I've tended to slow down.
No.
Playing football.
Getting old now, 92.
You're looking very good on it.
Oh, I don't know about that.
You look, from this, terribly fit and healthy.
Yeah, I am terribly fit and healthy.
God, are you really 92?
I am, sweetheart.
You look fantastic.
Thank you. 93 in September, actually.
Whoa, that's fantastic.
I would not do something to promote my own death, because I would not want my children to go through what I went through.
Yeah, sure.
That is the only thing that stops me.
Sure.
So
sure.
Each day I wake up, I think, oh, Jesus Christ, another day. You're here whether you want to be here or not.
Yeah, sure.
Must be a reason for it.
Well, there must be a reason for it, mustn't there?
Yeah. Just bug a lot of people on the way.
What do you think would help with all of this? I see you've tried some antidepressants in the past, haven't you?
I did, and oh God, they made me so bad.
You didn't really get on with them at all, did you? I mean, it sounds to me, there are a lot of groups that can help people who've been feeling down or struggling a bit.
Yeah.
And if you're the sort of person, particularly who is quite sociable by nature, you might really find that helpful. Would you like to give that a go?
I don't think so.
You wouldn't?
I'm not ready for the lunch with the old people. No.
The other thing is, have you met Heather, who's one of the receptionists here?
She got me, and I was going to do some voluntary work.
Yeah. Can I ask Heather to give you a ring again and see what else she can do? Because I think it's more. I think it's something you need to do, isn't it? Because I think it's more the social side of things, really.
The falling asleep. I wonder, could I have a blood test to see that I'm not anemic? I've always had it.
Oh no, you did. You had one in March.
Yeah. It would show up if I was.
It was slightly borderline. It was just about all right. Let's check again and make sure you don't need any iron tablets.
Yeah, that's what I'm thinking, because over the years I have had to go on.
Yeah, and that can give you problems sleeping, definitely.
Yeah, exactly.
Okay, so book in for that, and I'll ask Heather to have a chat with you.
Okay.
Okay.
Oh, sorry you had to get me on.
That's all right.
The sun was shining over the nursery courtyard.
What's a courtyard? A field.
What's a courtyard?
Is it a field?
Courtyard.
Is it like a field?
It's a playground now.
Yeah, it's like big concrete.
Okay.
Yeah.
You're a new patient here?
Yes. Been overseas.
Right. And where have you been?
All over Africa, and the last 3 years was Sri Lanka.
Right. Very nice.
So moving around.
What were you doing?
I'm a minerals person, so I'm scratching around looking for gold and diamonds normally.
Right.
Haven't found enough yet because I'm still working. So.
Yeah. And you're not from the UK originally?
No, I am. I'm fully English, but
right.
Not many gold deposits around Bristol or diamonds or a bit of coal in South Wales. Used to be some tin in Cornwall.
Okay. So what have you come for today?
The main one I actually want to come back is I've had a lot of sun.
Yeah.
And my brother had very bad melanoma, stage 4. Very lucky to still be around after 6-7 years.
Right.
And so I've had lots of things burnt off me, taken off me.
Yep.
I now have this thing on my head, and of course, coming to a doctor, it's the smallest it's been in 7 months.
Right.
It looks a bit weird. It comes and goes. It bleeds a bit.
Right.
It gets bigger, smaller. So I basically wanted someone to look at that.
Okay. All right. So I'm just going to look at it with a bit of light and some magnification. Okay. So it's a raised lump with a little dip in the middle. It is a bit sort of pearly. So there is a small possibility that that is not a malignant melanoma, but a different sort of skin cancer.
And sometimes if I just scratch it the tiniest bit, it'll bleed and run down a fair bit. And
yeah.
I believe that's not necessarily...
So it's 6 millimetres. I think it'd be reasonable to go and see somebody about that. There's an urgent referral where you'll get seen within 2 weeks.
I'm actually going away right now.
Yeah.
For 13 days.
Okay, right. So
I would like to have done it urgently, you know, but...
Yeah, OK, well, hopefully they'll just see you...
After 2 weeks.
After that, yeah. Have you actually had skin cancers removed?
I've had, I'm never quite sure, carcinomas, basal cell carcinoma. Basal cell carcinoma. Okay. Does that classify as a skin cancer?
Yeah.
It is, yeah. I think I've had 1 or 2 chopped off.
Are you going to be in the UK?
No, I'm going to Italy for 13 days,
right.
basically. I'm actually going to leave now. Taxi's coming in half an hour.
Right.
45.
OK. I'll put it at the front desk in an envelope. You can pick it up when you get home, OK, from your holiday. OK.
Thank you, Doctor.
That's all right. Bye now.
How are you today?
Good, thanks. You?
Yeah, not too bad. The sun's come back out, so I'm happy with the sunshine.
Oh, good. You're going to have some time after your shift to play with it?
Well, I'll be home about 7.
Oh.
Does Sally want to sit over there? I was just getting you
Yep.
a seat, sir.
Oh,
sorry,
thanks.
I don't know your name. So.
Keith.
Keith. Hello, Keith. I'm Linda.
Hi, Linda.
And what's your name?
Thanks. This is Lily.
Lily. Hello, Lily. And which side do you want the injection?
Maybe the left, because I'm right-handed. That makes
Okay.
sense. Turn around.
That's fine then. You go that way then, Lily. That's right.
Is that enough room to get whatever
fine.
you need?
Only want the top of your arm. So I'm giving you a booster of your tetanus. We talked about it on the phone. Didn't we?
Yeah.
Tetanus, diphtheria and polio, all in one. Sally came to see me because she needed some travel injections because she is travelling to Chicago in September to compete with the Great Britain blind sailing team.
I said what I was doing, didn't I?
You did, yeah. Wow. Exciting, isn't it?
Yes, she's got to do all the training now.
Sally was born with normal vision, but when she was about 6 years old, she contracted an eye condition called uveitis, which has left her with only 5% of vision. Is the training based in Bristol?
Some of it is. So we've just come from the swimming pool, actually, done 30 lengths. And yesterday I was doing some quite evil core fitness training to simulate racing a boat. So pulling a 40-kilo tyre around the gym.
Right, OK.
And then tomorrow I'm off to UK Sailing Academy to train with the Great Britain squad. So we'll be on the boats at sea. So.
Wow. And where's that? Portsmouth? Or
It's Cowes in the Isle of Wight.
Yeah. Nice. And you're going to have nice weather for it as well, so it'll be lovely, wouldn't it?
As long as there's wind, we don't care what else there is. But if it's sunny, that's an extra bonus.
It is, isn't it? I should think so too. So you OK with needles?
Yeah.
Yeah? All right, then. I'm just going to pull your sleeve up a little bit there, Sally, all right? Here we go, then. Sharp sting. There we go. All done.
Great. Is that all right to put down,
All right, that's fine. So that would last, in theory, 10 years.
Great. Thank you for fitting me in so quick. Thanks.
OK. It's a gold medal, won't you?
A gold medal. No pressure, no pressure.
No pressure, no pressure. Just a gold medal. OK, nice to meet you.
And you.
Bye-bye,
Thanks, Linda.
Lily, too. Bye-bye.
Bye.
Oh my God, look at these. Oh, these cakes look amazing.
I very rarely eat cake, and so it has to be really good before I bother.
Rarely eat cake?
Well, these are always good when Heather does them.
George Anderson, please. Oh. Hello, George.
Hiya.
Sorry to keep you.
That's all right, I was late myself, actually.
It's all worked out then.
Yeah.
Come and take a seat. How are you?
Extremely tired. I'm exhausted all the time. I don't know what's going on, but the right side of my skull is changing continuously. It's getting big bumps, big dips, hurts like hell. I have no idea what's going on. I haven't banged it or anything, but it's completely deformed. There's not an inch that is smooth, and it hurts. Touch it and I scream sometimes.
Okay. How long has this been with you for?
Months.
Okay.
It's months.
Mm-hmm.
Yeah.
Let's just have a look and see what's going on.
Yeah.
Have you found any bits that are itchy or any particular spots?
But they change continuously. Every day there's a new, and it's not like swelling because it's really hard. It just feels like the skull itself has gone over.
Well, there's nothing to be concerned about in the sense that there's no skin lesions or scalp lesions because some people get cysts or other things or spots or
Oh, no, it's a very
something or
different kind of pain than the cysts.
But,
Like.
I mean, it all feels like a normal, it feels normal to me.
Really? And this really gets me, especially in the evening, it starts to hurt. And I'll just brush my head or just touch my head and I'm just like shocked at the amount of pain that there is. And I start touching and I find all these painful spots.
So it might be what we call dysesthesia, or it's an altered sensation.
Yeah.
It's almost perhaps some kind of superficial nerve thing going on. But I think we'll just watch that. George is currently 59. He has quite a few complex medical health problems. He suffers from cluster headaches. He's hepatitis C positive and HIV positive. HIV, if it's caught early, is no longer a death sentence. In fact, people can live a near normal lifespan because there have been significant advances in the medicines used to control the rate of growth of the virus. I'm pleased to say that currently George doesn't suffer from any issues related to his HIV. It's well controlled. However, unfortunately, he has also been under significant stress recently, which has led to anxiety and low mood symptoms.
I didn't take the antidepressants at all.
Okay.
I made a conscious decision that because they take so long to work, and there's certain things that, they basically castrate you. I mean, your sex life just disappears. And that is one of the only things that actually keeps me alive and happy a little bit. And to eliminate that would be just dramatically wrong.
If you're happy not to start that, that's fine.
I need my faculties, and I actually need a little bit of extra emotion to get through something instead of just kind of letting everything just, which is what happens a lot of times.
That's quite a valid point, actually, because sometimes some people can feel a little bit subdued on them.
Yeah.
You're not vomiting? You're not waking up at night with headaches?
Not those headaches, no.
No. And no symptoms on your face or in your jaw or in your mouth?
No.
Okay.
No.
All right. Well, you're going to be due some tests and things when you go to the Brecon unit next week, but maybe we could touch base in 6 weeks or so, and you can keep me posted.
Yeah.
Obviously, if anything bothers you before that,
Yeah,
then
sure.
come in sooner.
Sure. That's it, yeah. Good.
Nice to see you.
Likewise.
Take care.
You too. Enjoy the weather while it lasts.
Laura Smith, please. Morning. All right. Just while I remember, I've got a message on my screen saying, can you go to reception after you've seen me?
Okay,
There's some message for them to discuss with you.
Yeah, all right, lovely.
Okay.
I'm just happy I got an appointment, to be honest.
Okay, what can I do for you?
So this pain, I've been getting it, my last 2 appointments, I had this spot of pain complaining about. I finally got my ultrasound tomorrow. Which is like a light at the end of the tunnel, but today it's the longest I've had an attack for. It's like, woke me up at like 5 o'clock.
What's the pain like?
Stabbing, I would say. Feels like it's in my back most of the time.
Right, okay.
But then it's also down here. Sorry, Craig's killing me.
Oh, dear.
Sorry.
That's all right.
I don't normally get weepy, but I think it's because I'm not sleeping.
Yeah.
But hence why I made the appointment, because I haven't ever gone 3 hours in that amount of pain. Tramadol isn't doing anything. My mum has been giving it to me since it started.
Right.
But, and I'm also concerned, what do I even do once I've had the ultrasound? How do I find out? Because I just want it gone. I don't know what it is.
Okay.
Before I forget all about it and go home with it,
Oh,
there
right.
is a pot of my wee for you. I bought you a gift.
I got my sample.
Oh, smashing. Cheers. I'll take that.
Wee-wees.
Yes, it's our wee-wees.
I those kind of days, dipsy days.
Is that enough?
Yeah.
If you're able to do that in the treatment room, that would be great.
It'd be marvellous. It'd be a miracle. I've just been...
Oh, have you?
So I haven't ever gone 3 hours in that amount of pain. And I don't know what I'm doing to kickstart it. Or... This is what the ultrasound's for, I suppose.
Yeah.
When I was saying I think it's gallstones, and I'm thinking, well, normally food or something kicks that off, and I'm not doing anything to start this pain off, so...
Right. When you get the pain, you use tramadol.
Yeah, but I'm taking tramadol as more of like a prevention.
Right.
Because it's pointless taking it when you're having the attack.
And when you're taking it, how many are you taking?
I'm only taking 2 a day because it keeps making me constipated.
Yeah. I think rather than taking it to try and stop it coming, I think we need to try and take it when it comes.
Really?
Yeah. I just want to have a little look at you. OK, if you jump up on the bed for me to feel your tummy. So have you got the pain now?
I can feel it in my back,
In your back.
but it's more of a niggling. It's not like the
Okay.
agony that I'm getting.
I'll just have a little feel around. OK. It's all there.
Yeah.
Isn't it? Yeah.
Sorry, I tense up.
That's all right. That's fine.
Yeah.
OK. Would you mind just doing a urine sample, just to check we're not missing anything in your kidneys?
Yeah, if I can get anything out.
So if you go and do that now and come straight back in.
Yeah. That's literally all I got, I think.
Yeah, that's fine. That's all I need. OK. Have you got your period at the moment?
No.
No. OK. So it's 2 platelets of blood in here. I don't think it's a urine infection, but I'm going to send it to the lab just to be sure. OK. One of the things that can cause sort of loin pain going through to the back, is kidney stones, and that can cause blood in the urine. OK. So I think what we need to do is wait for this scan tomorrow. Yeah. If it shows gallstones, fine, then we refer you to have it removed.
OK.
If it doesn't show anything, I think we'd then need to consider, do we need to do a CT to look for kidney stones?
Yeah.
In the meantime, I can give you a small supply of tramadol, but like you say, they are very addictive and they do cause constipation.
Yeah.
OK. The other thing I could give you that does work very well for gallstone-type pain is a suppository. So I don't know how you'd cope with that, how you'd feel
I'm
about
fine with that.
Good.
But if it's lasting this long, Oh, sorry.
It's all right.
I think I needed a bit of a rant as well.
That's OK.
Yeah. Thank you.
No problem.
Thank you
OK,
so much.
no problem.
Have a nice day.
You
all
too.
right.
Bye-bye.
Snapped a cyclist. Oh, no. I stood waiting for my bus and I'm looking up the road and the bus is coming down the road. Oh, and you put your hand out? And I put my hand out and I went like that. Ah! But he was Did you knock him off his bike? No, he was pushing his bike up the road on the wrong side of the road. Well, there you go then.
You had a nasty injury, didn't you?
I did. I've just been up to see the consultant. He's just taken the stitches.
OK. It was a bike accident?
Yeah, came off the bike and displaced the shoulder, so they've put it back. I went for a CT scan at the RUH, and that was why I was coming back, really, because they said you might want to go see the GP just to check. Because I told them that I get these really bizarre headaches, but I get a line across my eye. But it's not blurry, it's just a complete blackout of half of my eye. Not 2, it's only usually the 1, usually the left.
OK, because that's an unusual pattern for a headache or a migraine or anything like that, because normally the headache or a migraine, what you're talking about is a loss of a field of vision, and it will be the same field irrespective of which eye is open.
No, it's not.
How long have you had the headaches for?
This has been going on months and months.
How often do you get them?
Probably 1 or 2 a month.
How long do they last for when you get them?
The intensity lasts about 10 minutes, and then I'll either go to sleep and try and sleep it off, or it tends to just fade off.
Do you feel sick with the headache?
Sometimes a bit
Do you
sick.
actually vomit
No,
or not?
no.
That's migraine, my book. Okay,
Yeah.
so a visual warning, followed by a nasty headache with some nausea. That sounds like migraine.
Yeah.
Okay. So one of the problems with doing CTs of people's heads, and you might do it for one reason, it finds something else. We call this the vomit syndrome. Vomit stands for victim of medical imaging technology.
Okay.
So this might be the vomit syndrome, I'm afraid. So this is an important bit. So there's no bleed inside your head. Grey matter and the white matter looks normal in the head, so that's, the thinking material. Down at the base of the skull, they're saying that there's something that looks a bit funny, and it might be it's a blood vessel that's slightly enlarged, or by lacunar infarcts, they mean a type of stroke.
What are we talking about?
I've had a slightly bad back for a few months. Sort of stiffness, stuff like that. Nothing too major, just, you wake up in the morning and it's always kind of there.
Yeah.
But then a week ago, last Sunday, I played cricket on Saturday, felt fine, and then on Sunday morning I woke up and couldn't tie my own shoes, never mind do much of anything. And it's been like that for about a week now.
So you've had the stiffness in the back for the last 6 months or so?
Yeah, I think it's a long-standing, 6'3", lanky, don't sit in chairs properly, bad posture all my life and all that kind of stuff, and it's just finally caught up with me. And then I changed jobs last year, and I think I just didn't have a very good setup at work. The wrong chair and this, that and the other for a few months, and it's just kind of brought everything to the surface a little bit.
But the stiffness is different from pain, or...?
This feels different. It feels like an injury, like a muscle tweak or something.
Sure. And let me just double check, the pain's just in the back, it's not radiating into the legs?
No, it's all lower back. The general stiffness I've had from a few months tends to be lower back, but depending on how I sleep and stuff, it can be a bad neck and other things.
Let's just lift this leg up. No weakness or numbness or tingling?
No, not that.
And peeing and pooing normally? Just checking the nerves are all OK. Stand up for me. I'm just going to press all here, if that's all right. Is it sore in the sides?
It's not sensitive to touch or anything like that.
Is it sore in there at all?
No.
Just touch your toes for me.
Not a chance.
Are you quite inflexible?
I'm fairly inflexible anyway, so there's no chance I'd be able to
stay sideways and just
my toes, but
just
quite
bend.
Whereas I get to about there and it starts to hurt, and if I go much further, it's going to.
Would that be your normal range of movement? Do you think?
No, it's a little bit. Well, I'm somewhat inflexible anyway, I have to admit.
Sure. And in terms of, I'm just looking at your medicines, you're not on anything regularly?
No, I've been taking ibuprofen for a few days.
Yeah. Well, do you want me to give you some stronger anti-inflammatories then?
That might be worth trying.
OK, well, let's try that. I think that it is likely that you've just tweaked it. There's no worrying signs of it being affecting the nerves, which is the medical worry for back pain. So I can just reassure you that it should all just settle down. So that's what's happened just in the last week. In terms of the last 6 months, though, I'm hearing that it may be that this is a stiffness problem and that there may be some underlying issue there. Now, there is a condition of stiffness in the morning that affects young men and causes back pain. And I think if you've been having that, then it would be a reasonable thing for us to check a blood test and an X-ray.
By all means,
The condition is called ankylosing spondylitis, which is an inflammation problem, and that's the thing that we just need to make sure that isn't there. And, it's quite likely that that's not going to be the case, but I'd just like to make sure that we get the blood test and the X-ray, and then get you back in to see your own doctor with the results of those tests in a few weeks' time. All right? If any other problems in the meantime, then let us know, but I think it will all just settle down with that plan.
OK, great. OK, great.
Cheers. Hope it settles down.
Cheers.
Bye.
I would be astonished if you'd had stroke, really. I mean, it seems really unlikely. You're very young, you're very fit, you're very healthy. There's no reason why that should have happened. What we do need to do, having got that report, is just do a quick neurological examination and get blood tests and check your blood pressure to make sure you've got no risk factors for developing a stroke. OK?
Yeah.
Let's do the blood pressure first, actually. Is this all making sense?
Yeah.
Let's put it round here. Yeah, OK. Have you been back on your bike since?
No, I did ask, and he said, I prefer you not to go on for at least 6 weeks.
Okay, that sounds sensible.
Yeah.
So that's a normal blood pressure. OK, so that's very reassuring. OK, I'm going to shine some lights in your eyes next. We'll turn the main lights off for this. So we're looking for the nerve head, if it's bulging or not. That looks absolutely normal. That's fine. OK, a bit bright suddenly. OK,
Yeah.
So look at me, and I want you to follow my finger with your eyes. Do you see double at any stage while you're doing this?
No.
I want you to raise your forehead up, close your eyes tightly, don't let me open them, that's fine. Show your teeth. your cheeks. So I'm just going to feel both sides of your face. I want you to tell me if it feels the same on both sides.
Yeah.
Feel the same? Okay. Just squeeze my fingers as tight as you can. The neurological examination is normal. The blood pressure is normal. We should just check some blood tests looking for other things that can predispose to stroke. So we're talking about raised sugar levels. We're talking about your cholesterol level. I imagine it's all going to be normal. It would still be good to just find out a bit more detail about the headaches. I'd like you to just clarify the visual symptoms a bit more and let me know after you've had the next one. I'd like you to keep a diary of when it happens, and I'd like to know a bit more about where in the head it is when you get it. All right? You can give me a ring to tell me about a bit more about the migraine once you've
I will
do.
another one.
All right,
Okay.
thanks then.
Sure then.
Thank you.
I hit my knee like that, but look, Lynn, it's a big lump already. And I said, I might have to come in on crutches tomorrow. The patient said to me, you need a doctor. I went, they're too busy for me.
Have a seat. So I'm presuming this is about your leg.
It is, yes.
Because it's a bit of a mystery, really, isn't it?
Yeah, have the scan people sent the information?
Yeah, so they said there's no sign of a clot.
No.
Which is good. Yes. Possibly early cellulitis.
It's just got worse. By the end of Saturday, it was extremely painful. And now the pain goes from the toes all the way up to the top of my thigh.
Right, so where is the pain?
It starts off because I've got pins and needles in the toes anyway, it can hurt.
And what's that from?
Don't know. When I drove home from work Sunday night...
Have a look at the other one.
I struggled to feel the clutch. It's old colour now, isn't it?
It is. That's exactly what I'm thinking. How long's that been for?
The last 24 hours, I suppose. Looking for a pulse. Yeah.
I'm pretty sure I can feel a pulse.
Yeah.
Yeah?
That's good.
Yeah, it is good.
It's good news. It's alive.
I don't like the look of the colour.
No.
What I'm going to just do is see if I can find a nurse to just check. We can hear a pulse as well. Right. OK. OK.
I'm feeling quite hot again now.
Sorry?
I'm feeling quite hot
You're
again.
feeling hot. Come in.
Hello.
Thank you very much.
Hi.
Hi there.
So he's had pain and swelling in the leg, and we've ruled out a DVT, but it just looks a different colour.
Yes, it looks very pale.
Yeah. I think I can feel them, but I'd just like to hear it. Is that Saul just doing that, is it?
That's all right, sorry.
All right, huh?
That sounds right, doesn't it?
Yeah.
That's good news.
Fine, all right.
Thank you.
Just reassuring, isn't it?
Yes.
Fantastic, thank you. Right, OK. What I want to do is ring and speak to one of the vascular surgical doctors. I don't like the look of the colour of that. I don't like the sound of the pain either.
Do you smoke at all?
I do.
Any plans to stop?
I want to. I tried those chewing gums, they're disgusting.
All right.
And when I give up smoking, I become a very quick lose temper. I'm like a Spanish bull, having head down, going...
Smoking. Do you smoke?
Yeah, I want to quit smoking, actually. I hate smoking. It's a waste of money.
It's a waste of money.
You are a smoker.
Sort of. I'm not really a proper smoker. I just smoke occasionally, sometimes, when I'm stressed.
You started smoking again? How many a day?
Not many, actually. 3.
Oh, you can stop that.
But it's that craving.
It is that craving.
It's like gambling. So I'm going to quit the smoking.
We've got to grab you while you're keen.
Yeah.
Now's the moment.
Bit out of puff, aren't you?
I am, yeah.
Why are you here?
Yeah. About a fortnight ago, I had a bug, bad, sweating. My chest has just got slowly worse and worse and worse. And last night I just more or less sat up all night just coughing.
Right.
Breathing's difficult as well. I'm trying to cough to get some up, nothing's coming up. But I can feel it rattling. Excuse.
OK, have you got any history of any breathing problems?
No, never.
OK, do you smoke at all?
No.
Have you ever smoked?
Yes. 12 years ago.
You gave up 12 years
Yeah.
ago? How long did you smoke for?
Since I was about 15, 16.
Have you noticed yourself wheezing at all?
Yeah, I am wheezing.
And how many did you used to smoke a day at the most?
30 to 50.
30 to 50
Yeah, when I
a
was
day?
smoking, yeah.
How do you find enough time in the day to smoke 50
I used to work
cigarettes?
on the markets, so you get there at
Just
6 o'clock in the
constant
morning.
train. Fair play for giving up then, well done.
Yeah.
What made you give up?
Grandson coughed watching Thomas the Tank Engine in front of me and had a fag in my hand, and I said, that's it, finished.
He coughed in front of you from you smoking?
Yeah, and I stopped.
Right, so we have this thing that we call pack years. So we work out your smoking history based on the number of pack years of smoking. Yeah. So the calculation is based on 20 cigarettes a day. So if you smoke for 10 years and you smoke 20 a day, that's 10 pack years. Yeah. OK, so let's average at 40. So you've got 68 pack years of smoking.
Not proud.
That is very significant smoking history.
Yeah.
So anybody who's smoked for a long time has a significant risk of something called COPD, chronic obstructive pulmonary disease. Yeah. So it's basically where you've got permanent damage to your lungs. Yeah. It makes you a lot more susceptible to chest infections and things like that. So pop your finger in there for me. Let's check you over now anyway. You look quite well, so hopefully it's not anything sort of like pneumonia or anything, but I'm going to have a listen to your chest. Right, have a stand up for me. Right, can we lift your T-shirt right up? Right, nice deep breath. So have a listen at the back. Try and touch your elbows together in front of you. OK, so you've got some crackles lower down on this right-hand side.
Yeah.
I think you've definitely got a bit of a chest infection.
Yeah.
It would be wise if we give you some antibiotics.
Yeah.
And then once that's clear, you need to come back and have a review of your breathing again. Yeah. And if you're feeling worse at any point, rather than getting better, make sure you come and see us again.
OK, thank you very much.
That's really helpful. Thank you for your help. Yep, bye-bye. So he was really helpful, the vascular doctor. He says the colour can alter and be very pale and dusky just from the swelling, and the fact that we've got the pulse means the blood supply is OK. So that's good. That's good news.
Good news, yes.
Can I have a quick feel?
Yeah, of course, yeah.
If you can lie on the bed, that'd be good.
Right.
Where does that hurt?
Hip.
Hip. OK.
I can lie down. Hang on.
You all right?
Back of the ankle now.
OK. Right. All right. You haven't fallen at all? No. OK.
I wish I had.
Yeah. Can we bend your leg at the knee? Yeah. And no. Where does that hurt?
The muscle that goes all the way up to my bottom.
All right. Up you go. With Raymond, we'd ruled out a clot in the leg, which was an important thing to do. But when I examined him on the bed, he could barely move his legs at all. He was obviously in significant pain. I was concerned there was either some hip problem going on or a problem with the lumbar spine. I think we need some more imaging today. So I think the best way of doing that is going to A&E.
Suss it out.
Right. I really hope they help us get to the bottom of this.
It would be good. It would be really good.
It would be good, wouldn't it? OK.
Thank you very much.
That's all right. OK.
OK, thank you. Thank you.
All the best. Bye-bye.
Thank you.
No, you made me laugh. I don't know why I'm laughing.
Oh my God, I've just been sat in the waiting room laughing my head off. My sister put a photo of me on Facebook and eating a chicken carcass. And one of my friends said, "Is that a rat?"
Well,
and I said, "No, it's my sister." Oh dear. Anyway, right.
Well, good. I'm glad it's keeping you amused this morning.
Oh my God, it's so funny. I just have to show you. Hopefully, it'll make your day.
Well, it is quite a photo.
Oh my God. Sorry.
It's fine. It's fine. Keeps me going.
This is great.
How are you getting on?
My knees are, on the whole, a pain.
Sure.
Still very painful. So at Christmas, I had pain in my right knee.
Yeah.
Which then got better.
Yeah.
And then I had a very bad acute pain in my left knee.
Yes.
And that is what is giving me most of the problems.
Right. And we referred you for the MATS referral.
Yes.
And they will look at both. Now, the right knee was the one that showed bad arthritis changes in the scan.
Yes.
And a little bit of wear and tear of the cartilage in the middle of the knee. Sometimes that can get locked in between the middle of the bones of the joint and cause your knee to lock and get stuck in one position. And that sometimes then needs them to trim it away and clean up the inside of the knee with a little operation. Whether it will need you to have a scan on the left-hand side as well will be down to what the MATS team say when they see you, I would suggest.
I would say generally it is getting better, but it's really affecting my life.
I think there's a difference between the two things that are happening, because one, we know that you've got really bad arthritis, and that's a different thing that's causing the pain from the thing that might be causing the locking, which is the cartilage problem. So let's boost the painkillers, wait for the MATS referral. I'll see you in about 4 to 6 weeks when we've got that, and I'll organise the scan.
Yeah, that's absolutely fine.
But please let me know if things get worse or you're worried or something else, all right?
OK, yeah, that's absolutely fine. Sorry about my entry. My goodness, that's
Don't worry. Keep me going all day.
Good.
See you later. Bye.
Thank you.
Nice to see you.
And you, love.
Take care.
See you again as and when.
Bye-bye now.
Hello.
You say thank you?
Have a nice holiday.
Yeah, thank you.
Enjoy the rest of your day.
Thank you. Bye-bye.
See you. Bye.
Hallfield Health Centre, can I help?
You're looking very down.
Yeah.
Tell me about that.
It's just, everything's just getting to me at the moment.
This is a cyst, and Dr. Lee said she didn't want to cut it out because it's right on the jugular.
Thinking about trying the Weetabix diet.
The Weetabix diet?
At this point, I have to do something which is fraught with risk.
Oh, hello.
With your medical history, I don't think anyone will want to go near you unless they have to.
Health Centre can help you. Good morning.
Thomas Candricow.
That's me. Thank you for seeing me on such short notice, Doctor.
That's OK. Come on in, have a seat. I'm Dr. Graham. How can I help?
Right. If you look at my history, last year I had this case of a similar situation like this where my mouth lost skin. I couldn't eat very much. But compared to it now, that was like a 3 or a 4. This started off again on Tuesday or Wednesday.
Yes.
I have lost skin everywhere. I haven't eaten a solid meal for 4 days.
Yeah.
I went to the pharmacist. They recommended something called codeine with paracetamol.
Yes.
Which the pain has subsided, but even now, here I can still feel that constant throbbing. My head is hurting. But this hasn't happened for over a year now.
Yes.
I don't know what's happened.
OK, and do you have this kind of problem anywhere else on your body?
No.
No? You don't have any problems genital?
ulcers or anything like that.
What do you mean by genital ulcers?
Well, you've got mouth ulcers, that's what these are. They haven't got anything on your penis or anything like that, no.
Nothing at all.
Very rarely there can be a connection when it's quite severe, but it doesn't sound like that's the case.
No.
Can I have a look in your mouth?
Right.
Yeah?
The only thing, doctor, my mouth probably smells a bit bad.
Oh, don't worry about that.
If you want to probably put on a mask or something, at least it makes me feel a bit better.
No, I'll be fine with that.
Thank you.
Hello. Are you Phoebe?
Yeah.
Very good. Let's give you a chair, Phoebe. Are you going to sit there?
There you go. Ready?
And who's this, Phoebe?
Nancy.
Nancy?
I got some spots.
Do you want to show the doctor where they are?
They're
Actually-
on my belly.
Well, wait a minute. I think I need to ask Mummy a few questions first, and then I'll have a look at your spots in a moment. All right? How long has she had the spots for?
About 4.5 months. And they're only behind the legs here and a couple on the belly, and they look like little skin tags.
She's obviously reasonably well. She looks
she's absolutely fine. I think she's got a little bit of eczema as well on the back of her legs.
Has she had eczema before?
Never, no. I think the hot weather's brought it out.
OK, we're going to have a look at your spots now, Phoebe. Will you show me your belly first? She's only got one.
She's got a couple on this
Oh,
side.
yes, I
You
see.
can see where she's pit, and they've
Yes.
cleared.
No,
but it's
there's
not-
one. Look, that's a perfect one there.
Yeah.
The other thing is, Mummy wants me to look at your leg. Do you mind standing on the chair? If you just keep a hold on her. Yeah, a little bit. The name for that is molluscum.
Yeah, that's what I couldn't remember.
I'll print off the sheet for you. So it is a virus. And you don't want to do anything with them. Although they all go in the end, they can linger for quite a while.
Yeah, it just feels like
Common, harmless, just try to ignore it.
But is that definitely eczema on the back of her legs there?
I think you'd call that eczema, but I mean, she may have got some spots and picked them and they've got a bit irritated. Let me give you some treatment.
Yeah.
Mild steroid, just for where it's bad. When you've cleared it up, leave it off and wait and watch what's happened. Okay. And if it then comes back, we would adopt a slightly different approach.
Yeah.
Here's some stuff on molluscum. I mean, she's got it very mild. Quite likely she'll get more spots. If she picks them, she'll tend to infect herself, but you can't stop her picking them. So.
Thank you.
Right, Phoebe, are you playing a game?
I need his gloves.
Phoebe, you may have that glove. Special present.
Wow, doctor's glove. Thank you very much.
Pleasure.
Throw it up.
No, that's Mummy's job.
Yeah.
Take the glove and take the book.
What do you say to the doctor, Phoebe? No! Can I?
Very good.
Right, you're going to take your glove?
It's lovely to see you. Bye-bye. Bye-bye.
See his next patient. Thank you.
Goodness, it's quite a lot, aren't there? And then open up wide. Yeah, you've got a lot on the roof of your mouth and on the back of your mouth as well. All right, so most of the time, this is due to a viral infection that we can't really name. But just occasionally, it could be that this is a viral infection called herpes. Have you heard of that?
Isn't that an STD?
It can be an STD, yeah, but it doesn't have to be. OK? And I'm just wondering whether it would be helpful just to rule that out.
Just to understand you, though,
Yeah.
because I haven't been actually sexually active for about 8 months because my girlfriend has a long-distance relationship.
It's probably nothing to do with sex, this, OK? So there are two sorts of herpes.
Right.
There's genital herpes, and then there's herpes, which is just like really bad cold sores.
Right,
OK? And that is probably all it is, but it's really bad, so I think we need to
do something.
Investigate it a bit more. OK, it's a little bit of a rough swab, so it makes it a bit sore, I'm sorry.
No, as long as it helps you find out what's wrong, I'm cool with it.
If you could lower your lips down, I'm just going to do it along here, because you've got quite a few examples there. OK, that's great. That's done. OK, so that will take a few days to come back. If it's negative, then it hasn't really progressed us as to why this is happening. But some people do get terrible mouth ulcers.
Yeah.
And there isn't very much that helps with mouth ulcers.
I've got 4 gels which I'm constantly using.
The problem is that as soon as you put them on, your mouth washes them away. If over the next week or two it's clearly just getting much worse and you're suffering a lot, then just come back in. OK?
Doctor, thank you very much.
That's all right. Good.
See you later, ma'am.
Yeah, bye now.
Michaela Farrell, please.
I'm so sorry I missed it this morning. I wrote down the complete wrong time. Oh, God. Thank you.
How are things?
Yeah, same. How's my x-ray? Same?
They're normal.
Yeah, I thought so. The tablets aren't doing anything. I really kept on with them and the side effects were fine. They went down.
The pregabalin?
Yes.
Yes, yeah.
It's just still got this bloat and then this twisty kind of pain. I don't know what to do.
And how often does the pain come?
It's always there, just hanging around in this little patch. Like, I just don't know what to do now. Last week's been quite bad.
Right.
I haven't really slept.
What do you want to do you
I
think?
don't know. I did some kind of... I know there might not be... Sorry. Oh, God's sake. I'm just fed up and I just want this pain to go.
Yeah.
I can't do it anymore.
I mean, do you think the bloating is a big thing?
Yeah, massive. I'm so sick of it. I just look like I'm pregnant sometimes. Like, that's not...
Yeah.
I never had this issue before.
Yeah. Okay.
Something weird is going on. I don't know. Ugh.
We've got GPs, we've got nurses, we've got other clinicians that can prescribe. You ring our number, 24 hours a day, 7 days a week, even when we're closed. We'll send you text reminders on your mobile phone of things that you book in advance. Modern. We are trying to go with it. We're trying to go there. I can't think of anything else. All right?
Thank you.
OK, welcome to the practice.
See you then.
Sean Walker. Hi there, come on,
Hey, how's it going, Mum? Oh, hey. So I came here like a few weeks ago because I had like a problem and it felt like there was like a lump in my throat whenever I was trying to breathe in. And I'm not too sure if it's all connected, but like you see last night I basically couldn't get any sleep at all because I've got like this mad stabbing pain here. And then it sometimes can feel like a sensation up here. I got given omeprazole and another thing, and maybe cooled it off a bit. But because like I've run out of that now, it's kind of like starting to get this neck sensation thing again.
So the problems up here have been going on for a few weeks.
Yeah.
Better with the medication to some degree.
Yeah, so like...
And then that's finished.
Yeah, to be honest, it's like last night I had like an episode, I'd say, where it was really at its height and I could really feel it. I guess that's been able to suppress it to some extent, I guess.
Do you smoke?
It's maybe smoke twice at night, usually, do you know what I mean? Like, that's it, I don't really smoke during the day.
Alcohol?
I don't really drink that much, to be honest. I'm not really a big drinker at all.
Caffeine?
Coffee a lot at work. Like a lot of coffee at work, actually, I guess.
Let me examine you.
Right.
So we're going to start at the top by looking in your throat. Say ah.
Ah. Ah.
It all looks normal in your throat. Now let's lie you on the couch and examine your tummy.
Right.
If we lift your shirt up.
Sometimes, like, when I was lying down last night, they'll just feel like a pain there, like, do you know what I mean? And you're moving about. And but, like, even if I move, like, sat up like this, I'd be, like, aware of, like, oh, this kind of...
OK, perfect. Yeah. There's a good chance that the two symptoms, the odd feeling up here and the discomfort down here, are interlinked.
Right, yeah.
What most commonly interlinks those two things is stomach acid. So sometimes when you get excessive acid production, it's uncomfortable around where your stomach is.
Yeah.
But also you get acid coming up and irritating your throat, and that can happen while you're awake, but also at night when you're asleep. The medications that you had, one of them was to suppress acid production. I think we should try a slightly longer course of the omeprazole. So rather than 2 a day for a short period, 1 a day for a little longer. Now, while you're doing that, I think a couple of lifestyle changes. We know that caffeine and nicotine are irritating to your stomach. Cutting out caffeine and trying to cut out the cigarettes will probably make a difference to the symptoms and allow your stomach to
get healed. Yeah, totally, that's OK. Thank you very much anyway. Thank you very much for your time, man. Cheers. Thank you very much. Cheers, man.
It's important for us to think how many tests we're going to do.
Yeah, of course,
Because I think tests can be quite difficult for you. The more we go through them, they get more invasive as well, and there's more radiation and that sort of thing, which isn't good either.
Michaela is quite a new patient at the practice. She has sadly been suffering with pelvic and abdominal pain for approximately 3 years. She's been investigated quite significantly, but nothing has been found to help us work out the cause of her pain as yet.
You know, I think it's really reassuring that all your bloods were normal.
Yeah, that's good. Good.
And your x-rays are normal, so it's good there's nothing sort of...
There's nothing really bad.
But it's also really frustrating, isn't it, that we can't say, that's it.
Yeah, I know. So, I don't know, what do you do now?
I think what we need to think about is helping you with the pain, really. If we got the pain better controlled...
Yeah, definitely.
I'm not saying get rid of it. Yeah. What our aim would be to manage it better.
OK.
And I wonder if we ask the pain clinic for some help with that.
Yeah.
Because pain is a strange thing. The pain pathways are really tricky, and it's how we feel in ourselves affects the pain, and it's a bit of a vicious circle.
Yeah.
You know, if we can feel quite low and stressed due to pain, and then that can make the pain worse as well.
Yeah, definitely.
So with the pain clinic, they haven't got any different medicines than what we use, but they look at it in different ways.
Okay.
So what are your bowels like? Have any diarrhoea at all?
No, never have diarrhoea. If anything, it's not like constipated, but like it will usually be every day or every other day I'll go, and then sometimes it will feel like it's not quite out, like I don't know. It just feels heavy and just, I don't know.
Okay. Why don't we try some fibre gel?
Okay.
Have you tried that before? No. So it's a sachet, it comes, and it's just a fibre that you add to some squash or juice or water. I mean, I still do wonder if it could be an irritable bowel type thing.
Yeah.
Okay. And it just helps the stool go through a bit more easier.
Okay.
Okay. I think it's worth trying for a couple of months and see if that helps. Yeah. Okay.
Yeah.
There we go. OK. So come and see me in a couple of months to see how you're getting on with this. All right, and I'll refer you for pain clinic in the meantime.
You.
All the best. Bye-bye.
How can I help?
It's about my leg. I want to see if anything can be done about the scar.
Ah.
Because it's quite hideous. And all down the back is just hanging there.
Yeah. How's the sort of numbness in that foot? Is it about the same?
Yes, I've got no improvement there. It's still numb.
And the operation was back...
December...
15.
15.
Yeah.
Yeah.
So the level of numbness, has it got any better or is it about the same?
It's still the same as when I had it done.
So I don't think that's going to change.
No.
Lorraine has a complex past medical history. At the age of 51, she was diagnosed with a lymphoma. During the course of having chemotherapy, she developed a clot in her right leg. She then went on to develop what's called compartment syndrome and an acute ischemia of the leg. What that means is that the clot expanded and she had to have an emergency procedure called a fasciotomy, whereby you literally slit things down in the leg to release the pressure. And it's an emergency situation, otherwise you're at risk of losing the leg. But you did have a bit of what we call foot drop after the surgery.
Yeah, I still got foot drop, but before I couldn't even lift it up.
No.
You know, I've now got control to...
You seem to be walking more easily than
It's a bit
before.
easier to walk, but I can't walk very far at all.
Well, look, it's got better, hasn't it?
Yeah,
From what you were going through, look how far you've come.
Oh, yeah, I mean, I couldn't even walk in the beginning. Now I can walk a little bit. And, yeah.
When's your next haematology appointment?
Next Friday.
And are they happy with everything that's going on?
Yeah.
They're just monitoring you, aren't they?
Yeah, I go every 4 months now, so...
OK.
I hope just every 4 months, that's all I want.
What are you hoping that they do?
I'm just
improve the appearance.
Yeah, because all this flesh here is just so loose.
Yeah.
I was wondering if maybe something could be done for it to be brought together, because I don't really want skin grafts after what I went through with the last one.
Do you moisturise the skin?
I do. I use bio oil on it, which they say for scars,
Yeah, and just general moisturising.
Yeah, I use moisturising creams and I use bio oil on the actual scars.
OK. It's a difficult one, Lorraine, because firstly, this becomes a cosmetic issue.
That's what I was wondering.
Which, secondly, With your medical history and with the tablets that you're on,
Yeah.
I don't think anyone will want to go near you unless they have to. I'm being completely honest.
Yeah.
And I'm not sure there's much that can be done there. If you open up other scars, you create scars on top of scars, and it doesn't really help it.
Yeah. I mean, would anybody be prepared to see me to discuss it, do you think? Because it is, I mean, it is ugly, isn't it?
Firstly, on the NHS side of things, we'd have to apply for funding for you to be seen, and I don't think we will get that.
Yeah.
Because I'm not sure that there's much that we can do. On the whole, cosmetic surgery is not funded by the NHS. There are certain exceptional circumstances whereby a committee looks at the evidence provided to make a decision on an individual basis. So, for example, if somebody is suffering from severe emotional and functional impairment as a result of their disfigurement, this may be looked at in a different way. I can discuss it with a colleague of mine.
Yeah.
If you're happy for me to take a picture.
Yeah.
Is that okay?
Yeah, that's fine.
It's nice to see you smiling as well.
Yeah.
You're happier in yourself, I think.
Yeah, oh gosh, I've come a long way.
You have come a
Yeah,
massively
from
long
what
way.
I was, because...
So leave that with me, so to speak. But I can't promise anything.
No, OK, that's fine.
Are we supporting you enough? Do you need any further counselling with what's happened, or you do feel you're happy?
No, I'm OK. I've had loads of counselling. I'm not on antidepressants anymore. I mean, I still get down days. Of course you do, but I think anybody who hadn't been through what I've been through gets down days, don't they? But
I think you're
on
an
the whole,
inspiration, actually, of how well you've done.
on the whole, I'm not doing too bad. I don't work, obviously, now. I've been retired. I just try and keep myself busy.
OK, we'll leave it at that for today, if that's OK.
OK, yeah, that's fine.
Nice to see you.
Yeah, and you. Thanks very much.
All
Thank
right.
you.
Bye-bye for now.
Bye.
Robert Bees, please. Hello there. Hi there.
Hello, all right.
Robert, you're looking uncomfortable.
Yeah, it's my legs still playing up and my back. I went to see Sakemead.
Yeah, these are the nerve conduction studies, aren't
Yeah,
they?
they'd done all that, and they said they was going to write to me, and I haven't heard nothing.
No, OK, I have to say I haven't heard anything either. I'll write to the neurologist and say, look, it looks, you know, this chap's had all his tests done.
Yeah.
They did the electrical test on your arm and your leg,
They've
did
done
they?
it on my arm and my leg, yeah. Oh, just down in the dumps still, really.
Well, you are, aren't you?
Yeah.
Let's talk about that, because that might be more important even than the pains, isn't it? So I saw, since I last saw you, I gather you were evicted from your parents' council house, is that right?
Yeah.
Where are you living now?
I just stay with my sisters.
Yeah.
4 days a week.
Okay.
And then I just stay with my daughters just on the weekend.
So is that the long-term plan, or are you trying to get something else?
I'm trying to get somewhere. I went for a property and they said I was unsuitable.
You're not in work now?
No.
No. How's it working out, staying with your relatives?
Not very good, really. But I've got nowhere else, so just got to do that.
Yeah. And you're looking very down, and you said you feel quite down.
Yeah.
Tell me about that.
Well, it's just the loss of mum still going to me.
Mm.
And my sister and my dad.
Mm.
Everything's just getting to me at the moment.
Mm.
How do you fancy draining a cyst behind an ear this afternoon? Yeah. I thought about doing it, but then I thought, oh, it sounds like something Tom might like to do.
What kind of cyst?
A very squidgy one that looks like it might be about to pop. It's probably about that big, very, very squishy.
OK. It would happily stick a needle in it and just see if it'll aspirate.
I think it will probably just aspirate. I think the second you put a needle in it, it's probably just going to go.
Yeah, well, that's fine. Book him in, I'll do that.
Debbie Kroll. Hello there. Come on in, have a seat. I'm Dr. Graham.
Hello.
So last time I think I had a water infection.
Did I?
Yeah. I think this is a cyst, and I think it's getting infected.
Okay.
It has been once before, and Dr. Lee said she didn't want to cut it out because it's right on the jugular. But over the last few days, it's hurting.
Yeah.
It didn't hurt last time, but it is hurting.
And has it changed as well as being painful? Is it bigger or?
It's bigger and harder, and it feels a bit warm.
Okay.
But I just know it's just... No, I feel a bit sicky, but I don't know if that's just... I don't know. I've got a job interview tomorrow, so I don't know if I feel sick because of that or if it's because of that.
Yeah, okay.
But last time, not at all did it hurt, and it just oozed horrible pussy stuff.
And nothing's come out this time?
No.
Okay.
No, so I don't...
Should we just take your temperature
Okay.
first? That's fine, 36.1, so that's normal. Just take your pulse. What's your job interview?
I work in a school anyway as a teaching assistant, and it's in the same school but for a different teaching assistant role.
Okay.
So yeah, I'm just a bit nervous. It's ridiculous.
Do you want it?
Yeah. I just think it's horrible when you work there and you have to have an interview with people you know. Yeah.
Difficult, isn't it?
It is horrible.
Okay,
yeah.
let's have a look. I'll just put some gloves on.
Okay.
Yeah, it has got a little head on it, hasn't it?
Oh, I don't know, has it? Okay.
Little white bit.
Yeah, so maybe it is then, because it doesn't usually have a head on it.
Yeah, that's how big it is. And it's a bit red up there as well.
Yeah. And that is sore when you touch
so
it.
I don't think you should try and squeeze it.
No, I won't.
Okay?
No, I won't.
And
no.
hopefully it'll get better with some antibiotics, which I think is what we should do. Yeah?
Yeah.
So we normally give 5 days of flucloxacillin, okay?
Yeah.
4 times a day. And if it's obviously getting worse, then you come back. Or if you feel ill, like you're being sick or something. It's basically a sebaceous cyst, which is part of the hair follicle that's got a bit blocked and caused a lump, and then that is prone to getting infected. So it's really common and not anything surprising, to be honest. As this is the second time it's happened, you could discuss with Dr. Lee whether she'd be willing to remove it. But I can see why she's a bit reluctant.
She's a bit anxious about that, I think, and that's fine. I don't want to,
Well, you don't want
it's
things
a bit risky. Yeah.
Exactly. Is that all right?
Yes, of course. That's absolutely.
And good luck tomorrow.
Thank you very much.
That's all right.
Fingers crossed.
Yes. Bye bye now.
Thank you. Bye bye.
Had you thought about if there was anything I could do to help you?
Well, you give me this letter to ring up about when I was down in the dumps before.
For get some counselling.
Yeah. They rang me back and said I can go to a meeting, which I went there and they was talking to me and everything like that. And they give me the number. They said any time you just ring. So.
I think it would be worth you ringing maybe and asking for some one-to-one counselling.
Pain her now with that lump as well.
Yeah, okay. Let's just stick with your mood for a second because I don't want to lose this opportunity to talk about that really.
Yeah.
So these were the people you rang, wasn't it? Bristol Wellbeing Therapists. Yeah. I would encourage you to give them another ring actually. Right. That's the number.
Yeah.
And say that you went to a group session before. Yeah. That you're very down in the dumps and that maybe some one-to-one counselling would be helpful, and they'll take that on for you.
Yeah.
All right, so I'd encourage you to do that. Are you still taking the antidepressant that you were prescribed by my colleague?
Yeah.
Can I suggest if you've not had side effects, but obviously you are still quite depressed, maybe we should put that dose up to 100 milligrams and see. Okay?
Yeah.
You're probably running out of it fairly soon, actually, aren't you?
Yeah.
So I'm going to give you a higher dose of the antidepressants. So I'll put a prescription for some of that through to the pharmacy next door. You're going to contact those people. I'm going to write to your neurologist. There we go. All right.
Yeah.
I think that's covered enough for today. But I'll come and see me again in a month.
Okay, make an appointment for a month's time.
Bye-bye.
Right, thank you.
Francis Pollard, please.
Hello.
Oh, hello. Have a seat. You Dad?
Yes, I am. Who are you, by the way?
Francis, then. I'm Lizzie.
So, I'm here for him.
obviously. So he had a bout of vomiting and being generally unwell a couple of weeks ago. And since then he's had a cough, but only at night. Just had a recurring cough for about a week and a half or so. It was pretty down to sort of recovering a little bit. But then he was a bit during the day, but now it's confined entirely to the night. So
do you think he's had a fever at all then in the last couple of weeks?
No, not since he stopped vomiting.
So has he had a snotty nose?
Yeah.
Can we take your temperature? Can we do this in your ear? Just beep, beep, beep. Ready?
Yeah.
Beep. Perfect. And when he's coughing, what does his cough sound like?
It sounds like he's got loads of phlegm in his. To me, he sounds like it's
wet. Sounds wet.
Yeah.
Okay. Has he been coughing anything up at all? Have you ever found any like nasty green phlegm or anything? You're very chilled, aren't you?
He's tired.
Can we take his shirt off and undo his baby grow?
Yeah. Can I just use your bed over here for a second?
Yeah,
because
that's fine,
I struggle to do this. Otherwise, it's a good boy. Who's my good little man? Where are we now? Where are we now? What are we looking at? I know. It's a terrible world, Francis, where I continually dress and undress you.
So is he waking himself up when he's coughing at night?
Yeah. Skin the bunny, Francis. Thank you.
That's a horrible thing to say.
That's what his mother says to him, and it works. He now puts his arms up in the air.
Oh, no.
I know. It's what her mother used to say to her, apparently.
Oh, God.
I think it sounds like a terrible thing to say to a child.
I think it sounds like a terrible thing to say to a child.
But now it's the only way I can get him to put his arms up to take his grow off. Come here.
Right, should we have a listen? Put this on here. Just turn him around.
Would you row?
His chest sounds completely clear. Let's have a little tap. Lovely.
You're fine, aren't you?
You're absolutely zonked, aren't you? I think he's just got a viral cough. Keep him well hydrated.
Come on, if I start reassembling him.
Yeah, that's fine.
It can take me a few seconds.
Reassemble your child. Is he in a cot?
Yes.
So prop the cot up underneath the feet, because if he's elevated a little bit, it's likely to help reduce his cough a bit.
OK.
If at any point you think that he's actually struggling with his breathing,
Yep.
if you start seeing the muscles really working hard in between his chest, if you can see his ribs appearing when he's breathing, come to us straight away, or if it's out of hours, give 111 a call.
OK.
You're happy enough, aren't you? Ticklish. You ticklish. You ticklish.
Why is it only at night?
It's just to do with the fact that you're lying down. OK, so any worries at all, give us a shout again.
Shall do. Thank you very much, Doctor.
All right, take care.
Cheers.
Bye. Bye.
I have got, I think it's a mole, but it's been a bit itchy.
We call it a seborrheic keratosis, and it's
Right.
just a little warty stuck-on thing.
Yeah.
It's almost like there's a crust over the top of it, isn't there?
It has been getting a little bit darker and bigger. Not that it's that big.
It's kind of a little bit of a dry, scaly one. And it's just quite soft and loose.
Yeah, so that's more reassuring, actually.
Well, the good thing about this one is that it's a little fleshy one that sticks up and you can move it around.
That's what the doctor said last time.
Kay Frankson, please.
Hello.
Good morning. I'll have a seat.
Thank you.
I'm Dr. Jewell.
Hello, Dr. Jules. I hope I'm not wasting your time, but it's just people keep telling me to come and see you because I've got this mysterious mole that suddenly appeared at the back of my knee.
So let's ask the standard question. Is it bleeding?
No.
Itching?
No.
But it's new.
It's new and it's...
But you don't, because if you have many moles...
No, not really.
The average number is 40.
Is it?
Yeah, so most of us have got a collection.
Oh.
So let's have a look at it.
It's this one, so it's at the back of my left leg.
Ah, at this point I have to do something which is fraught with risk.
Oh, hello.
Get down on my... Is it this thing here?
Yes.
Okay,
well, there's
that
a cysty thing as well.
Have you seen? Have you looked at them?
I can't see them
So
really.
which is the one that everyone's worried about?
The one that's actually coloured and looks like a mole.
Well, you've got 3, 4 of those.
Oh, well, there you are. You see, I can't even see them, so I didn't know.
These are obviously, quite obviously, warts. Because what they're doing...
That's horrible.
Look, what they're doing is when you bend your knee, You're spreading them. I think the sensible thing to do is to take a photograph of them.
I've done that. I did it the other night to have a look because I knew I was coming to see you.
You know, check it again in a few months' time.
It was quite hard to take, actually.
Oh, I'm not suggesting you. Surely you can get somebody else to take it, can't you?
I could do. Hello, would you like to take a picture of my mole?
I don't really have any other suggestions because they look completely normal.
Okay.
All right.
All right. So that's it then.
Yeah. And do come back if you're worried. You know, don't. Whatever you do, don't let concerns about wasting anybody's time deter you. That really, you know, this is a 5-minute business. It's taking a bit longer, but
all right.
It's not a big deal at all.
Okay. Well, thank you very much for reassuring me.
Good.
And have a nice day, as they say.
Bye-bye.
Bye-bye.
Bowers. Come and have a seat. I'm Dr. Barnard. I don't think we've met before, have we?
Not before. Basically what it is, I'm a diabetic.
Yes.
And I got an infection, I got a blister to my little toe and the next toe.
Yes.
Underneath, and I think it's got infected. Because it's really sore, I can't walk properly, and there's like a red line just starting to go up there. It's not the first infection I've had in my feet before. It's...
Oh, goodness, that looks
really
quite nasty, doesn't it?
Yeah, it's very sore.
How long's it been going on for?
It's only started getting red and swollen past 2 days, and that line just showed up this morning, but it's been sore for a week.
Right.
But I didn't think it was infected because I kept it clean and stuff like that.
Yeah.
But it's just, I think my toes swollen as well, and that line's coming up, which is worrying me a bit.
And are you under podiatry or anything like that? Have you been in the past?
No, because I don't like people touching my feet. I hate it.
Okay.
I can't bear people touching my feet.
Can I have a look?
Yeah. I mean, I must admit the one on this toe I left a bit too long and it got very nasty.
Pull that toe back for me.
This one?
Yeah. It's really painful, isn't it? Put your foot back down again. Fine. OK. That looks really sore.
It is sore.
Because you've got the diabetes, we have to be really careful, because you know if we leave foot infections untreated or not properly treated in diabetics, it can be quite serious.
Lee Haskins. Hello.
Hello, you all right?
Yeah. Come on in.
Thank you.
Have a seat. How can I help?
It's my right kneecap.
Okay.
I'm all right doing long walks, but when I stop, it seizes up.
Right.
And I have to let it rest for a while before I can... And if I start walking it straight away, it hurts.
Yeah.
I can kneel down on this knee, but I can't put this knee down properly.
No. Can we have a look at your knees? Do you want to just pull up? And could you do that with the other one as well, just so I can compare them? That's it. You can see that it's a bit swollen up there, can't you? And if I just have a press round that side, that's OK?
Yeah, it's fine.
Round here? Does it actually hurt if I press there?
No.
OK. And if you fully straighten it, does that hurt? No? Bend it? Straighten it? Well, that's pretty good, isn't it? And if you just move your knee just so that your ankle's there, yeah. And I'll just give it a bit of a test. It's quite stable, isn't it? Yeah, good. OK, you put your trousers back down then. Your knee is taking quite a lot of weight at the moment because it's the main joint that carries you around. Have you had thoughts about losing quite a bit of weight at all? Any thoughts about I mean, I think it would really help with what you're here for today.
Think about trying the Weetabix diet.
The Weetabix diet? So what's that one?
Just Weetabix 3 times a day and that's it. And
Really?
you play with your fruit.
Right. Sounds a bit crazy to me. What do you think about it, really, the Weetabix diet?
I think it's all right.
Yeah? I mean, do you know how people successfully lose weight?
Well, you've got to mix the exercise and the healthy eating.
Yeah. Most of losing weight is simply eating less. So I actually say that most people who successfully lose weight just say, I'm going to change the way I'm going to eat for the rest of my life. Because a lot of people do these diets, like a Weetabix diet, and unfortunately, when they go back to what they normally do, they just put the weight back on. So sometimes I suggest to people they just reduce the quantity, because quite often, quite a lot of us are eating more than we need to.
I don't really have breakfast. Sometimes I have lunch.
Yeah.
But I do have a dinner.
Yeah. People who eat breakfast are in general thinner than people who don't. And people who eat a small regular meal 3 times a day are lighter than people who don't do that. Your body is sort of needs regular eating. We all eat our main meal in the evening in this country. And the problem with that is that we're having a lot of calories and then we go to bed. And actually, when we need the calories is the morning and the lunch, and much less in the evenings. If there's any way that you can change that around and have your main meal at lunchtime, that's supposed to be healthier.
Okay.
If you wanted some more help about losing weight, then you could book maybe to see one of the practice nurses or something along those lines.
Okay.
Is that all right?
Yeah.
Okay.
Thank you for that.
That's all right. Nice to see you.
Nice to see you.
Bye now.
Bye-bye.
Can I touch your feet to see what the pulses are like?
Yeah, both feet.
If it's too much.
No, it's okay.
Is that very sore?
Yeah, that is, yeah.
Okay. Patients with diabetes are at increased risk of having problems with their feet. This is because the diabetes may reduce the blood supply to the feet and may affect the sensation. This means that patients may not notice when they've got a sore foot or an injured foot. If it is not treated promptly, the patient is at increased risk of having a serious infection and ultimately, in the worst cases, at risk of amputation. What I'm going to do is I'm going to give you some antibiotics. We're going to get you booked in with the nurse to get it dressed and things, and then I'm going to have a look at referring you to the diabetic foot clinic.
Okay.
If I do that, will you go?
I promise you I'll go, because I don't like people touching my feet, but I don't want to lose my feet either.
More than anything, we need them just to look at it, keep an eye on it.
Thank you so much.
So look out for the appointment, but if there's going to be anything different, and they're just going to give you an appointment straight away, I'll ring you.
Thank you so much. Thank you.
Okay, bye.
Bye.
Mr. Thomas, please.
That's me.
Hello. Sorry, you've waited a little bit there.
That's all right.
There we go.
Thank you.
Right, do have a seat there. Hello.
Cheers, hiya.
Hi, I'm Dr. Bolam. All right. What can I do for you today?
Well, it's been coming on about 3 weeks now, this lump. It started off, well, didn't even notice it really, and then gradually, it's not got any bigger. It kind of, if anything, spread slightly.
Yeah.
It's just fluid, I guess,
Yeah.
but I thought I'd leave it a few weeks and it'd probably go away.
I know exactly what that is.
Right, yeah,
Okay, it's a bursitis. Okay.
Yes.
So we all have fluid-filled sacs around our joints called bursae.
Right.
Okay, which can get swollen all of a sudden. Okay, usually caused by repetitive trauma. So that one there, people get them on their knees often. Anybody can get it.
I got you.
So that's an olecranon, that one, over the outside of the elbow. All right. Is it painful?
No.
No, not painful.
Maybe
Okay.
if you put pressure on it, like lean on it or something, it might be annoying.
They can get infected, but it doesn't look infected, so we don't need antibiotics.
Oh,
all right?
Okay.
Usually, the first line is to take an anti-inflammatory.
Yeah.
Right.
Yeah.
Get something to compress it. So go and buy yourself an elbow support from the chemist.
Yeah,
All right.
okay.
Put ice on it, and it usually just goes away. All right.
Brilliant.
And only if it gets red and hot and horrible do we need antibiotics, and we're not at that stage at the moment, certainly. All right. Yes. Have a little read of this.
Yeah, sure. Thanks.
Tells you how to treat it.
Well. I lost the wife coming up 5 years August, and seeing her in conditions that she was in, it does tend to make you...
Yeah.
I mean, I don't come to the doctors
Yeah.
very often at all, but it suddenly... you think, well, one thing, keep on top of
Yes,
it, you know.
I can absolutely assure you that's nothing.
Ah, lovely.
100%,
All right.
actually.
Thank you very much for
All right,
putting my mind at
OK.
ease.
All right, OK.
Thank you, Doctor.
OK. Have have a read of that.
Yeah.
Do what it says.
Thank you very, very much.
Is that okay?
Yes, thank you,
All right,
Doctor.
OK.
Cheers now.
All right,
Bye-bye.
have a nice day. Bye-bye.
Bye. It's all right, I've got a bit of OCD as well, don't worry. It's not worth talking about, I just handle it.
All right. Okay.
Bye, thank you.
All right, bye-bye.
Bye-bye.
Bye.
Thank you. Have a nice day.
And you. Bye.
Thank you.
Bye-bye.
Bye. Do you feel better now?
Yeah, I feel better. You gonna say bye now?
Reluctantly. See ya.